Today I'm making the drive up to North London to see a wonderful charity called All Dogs Matter. They do really amazing work here in London where they rescue and rehome abandoned dogs. It's run by Ira and her team, and today they've asked me to come and visit a really beautiful Labrador who's got some really big problems.
Good boy. Good boy. He's a good boy.
I was expecting this really poorly, three-legged dog to come in, and the van pulled up outside and we could hear the biggest woof ever, followed by the back door opening and Marcus jumping out. We instantly fell in love with Marcus. He's adorable.
From the outset, Ira also noticed that the abandoned Marcus had a large lump growing on his leg.
We thought that maybe the reason his back leg was missing was he'd had a tumour before, a cancerous lump, and it was removed. So we thought possibly the new lump could also be cancerous. So our thought was, look, this guy is going to be put to sleep if we don't take him in. Let's at least give him a chance. Let's get the lump tested.
Hello, ladies. How are you?
Hello, mates. You must be Marcus. Oh, you're a handsome chap. Oh, thank you. Big smooch. And he seems like in pretty good nick. If anything, he seems like he's been overwintering quite well. Marcus has been to the school of hard knocks. He has not got a home anymore. He's lost a leg. And now we see this lump on his leg. I mean, how much bad luck can one dog have? You want to be very brave while I stick a needle in your arm. Right, so this is a microscope slide box full of, guess what? Microscope slides. Yeah. What we're going to do is we're going to pop a little needle into that nasty lump. We're going to take some cells. We're going to pop it on a slide. We're going to send it to some smart people at a lab, and they're going to tell us if we should be worried. How's that sound? Are you worried? No.
We'll be waiting with bated breath, hoping that that comes back as benign. And as soon as we get that result, we'll sort of start looking for Marcus's forever home. That's our hope. He's such a special boy, and we're just hoping and praying for him that it'll all be good. An extra kiss for luck.
Yes. Yeah, you deserve it. Boy.
Slowly, slowly. There you go.
At Ottershaw in Surrey, Scott's longtime client, Ali, is getting ready for another trip to the vet.
Slowly, sweets. Good girl.
Her 2-year-old boxer cross, Mabel, is limping badly on her right back leg and is now restricted to slow walks.
Can't go hooning around. No, just boring lead walks. Slowly. Good girl. She struggles to get out of bed, and that's really sad to see. You feel awful, don't you? Because you don't want anything you love to be in pain. Slow down. Slow down. It just doesn't seem fair. She loves to play. All she wants to do is play. So when you stop her doing that, of course you feel mean. I feel terrible.
Ready?
Go. Go on, Mabes.
Ali has tried everything to help Mabel, from a regime of low-impact swimming to days of complete rest.
Don't cheat. Keep going.
But nothing is working.
You're tired. I've taken her to see Scott, and we've tried the softly approach. We've tried the kind of non-intrusive approach of just rest and lead walking. The back leg, it's just not getting any better. If anything, it's getting worse. Good girl.
Hello, gorgeous.
Yeah.
Ali and Scott formed a close bond 3 years ago, when Scott helped Ali's first dog, Ruck, fight a long battle against cancer.
Who is this?
This is Mabel.
Hello, gorgeous.
When Ruck finally passed away, Ali adopted Mabel from the Battersea Dogs Home. Right from the start, the boxer cross had issues and needed rehabilitation on an old break in her left hind leg.
Oh, wow, she's got some pace. Hey!
Eventually, Mabel's left leg did come good, but within 6 months, she was hit by the latest problem.
Good girl. I know, it's not fair. I know. I feel sorry for her, and I shouldn't feel sorry for her because they live in the moment. She doesn't feel sorry for herself.
Ali's hoping for solutions from Scott today, but also dreading what he may tell her.
I need to find out exactly what the problem is. I dread most of all if it's spinal. It's so dangerous. and God forbid it's neurological, we can't do anything. You know, maybe that's what the scans will show. And so, of course, those fears are there. Come on then. Good girl. You just got to take a deep breath, suck it up and deal with it. It's not me that's in trouble, is it? Sit down. Good girl.
Are we going to go to the vet? Yeah? Off to the vet now. You'll be a good girl, won't you?
In Twickenham, southwest London, hedgehog enthusiast Anna is having some playtime with her 1-year-old African pygmy called Hazel.
She just wants to run.
There's so much to love about her. She's got such a huge personality for such a little creature. She's very bossy, and she will make it quite known when she's not happy.
Oh, I know.
African pygmies were brought into the UK more than 10 years ago. Now hugely popular, they're the only hedgehogs that can legally be kept as pets.
Are you hungry?
But Hazel is so spoiled by Anna that this little girl is now suffering from an all too common problem.
So Hazel is a little bit overweight, which has been an ongoing issue since she was little. But with internet community and forums, you start to realise that actually maybe she's a little bit rounder than most of them. Maybe there's a bit of an issue here. And obviously, the last thing I want is for this to develop into sort of other health issues.
Ready? You're going to sit in here? You get comfy.
Hazel's expanding waistline is even more surprising considering her nocturnal activities.
Hazel has a rather large hamster wheel, and I've got a bicycle odometer on it. So when I say Hazel ran 9K last night, people are going, what? That's insane. How can she do that? And you go, well, you know, she's quite fast. She will outrun me. Definitely, if she wanted to, she could.
Hi. Shall we go see the vet?
Today, Anna's taking Hazel for one of her regular checkups at Scott St Margaret's practice.
Oh, yeah.
Hi. How is Hazel today?
Here she is.
Is she in her little hood that you've made for her?
Having a little visit to the vet.
Hello.
Receptionist Elle has developed a soft spot for this curvy patient.
Hi. Hazel's here.
Hazel. She's very shy today.
You are a bit shy today. Let's get her in before we get her too stressed out for too long. Come on through.
Good. Let's be good.
Head nurse Emma has been overseeing Hazel's weight loss programme.
I've not seen her for a while.
So we're struggling a little bit.
With the weight
issue,
yes. So last time we weighed her, she was just over 0.6 of a kilo. So we just want to have a check and see how heavy she actually is.
There you go.
What a good girl. Ooh, 0.63. Okay, still a little bit for her size. She's a little bit on the larger side of life.
A bit round.
She's a little rotund, bless her. In an ideal world, we'd like her down to the ½ kilo mark, maybe a little bit less. The African pygmies do need to be a little bit more svelte than what she is, so hopefully we'll get there.
Emma is now recommending a stricter diet and definitely no treats for the little hedgehog.
Making sure that it's sort of low fat.
Yeah, all low fat.
I think it's been an issue from when I got her. I think her breeder was quite generous in feeding, and obviously it being my first hedgehog, I think maybe I've just been spoiling her a little bit as well.
So let's keep on with the weight loss and the portion control. Hopefully she'll find that little bit of a double chin might decrease a little bit. And tell you what, if you get rid of yours, I'll get rid of mine. Deal?
Deal.
Shake on it. Little mini hedgehog shake.
Get your leg fixed.
Later that day, a very apprehensive Ali arrives at Scott's Richmond practice.
Hello.
Hiya.
How are you?
I know, don't be scared.
Hello, gorgeous. Hello, gorgeous girl. How are you? Are you all right?
Hot and bothered, I think.
What's happening?
What can you see?
Oh, she's walking quite weirdly, isn't
And she won't wait there on the rear right.
Mabel is looking really bad, actually. I mean, I'm surprised to see her barely putting her foot down. We'll just give her a walk and let's see what we've got.
Come on, sweet. So she's a bit marionette, I think. She's a little bit wobbly, but...
I think wobbly is an understatement. Well, I think what's probably best is that we take you downstairs. You know you get VIP treatment. All right, well, let's get cracking. Come on, Mabel.
Come on then.
Good girl.
Come on, sweet.
Hey, let's attempt some stairs.
Yeah, that's always a
That's
laugh.
going to be fun.
I know. Come on, I know.
You manage? Oh, good girl. That's it. Well done. Nice and slow and steady. She's stepping really slowly and she's looking more like an arthritic 15-year-old dog than a youngster. We're going to do a quick neuro exam and just have a look and see what's going on.
Do you want me to do anything?
Just sit there and talk to her because I'm going to be doing some pretty weird things to her. Up we go. So that's Hammy's standing. So that's quite good. It shows at least that she knows her leg is there.
Okay.
Now let's see if she can move it like this. Yeah, that's where you struggle, isn't it, sweetie? So very, very weak on that side.
With no sign of neurological issues, Scott is now testing for spinal problems.
Nice, strong patellar reflex. That's quite good. If that wasn't present, that would suggest that there was issues maybe in the lumbar, the lower lumbar part of the spine, but...
So that's good news.
That's pretty strong there, yeah. That's good. I know. Sorry about that. It's weird. I'm hitting you with scissors. I know. I'm just going to have a feel of this knee now.
Oh, she doesn't like it, though.
You don't like that, though, do you, baby? So there's definitely a little bit of discomfort here. She's not impressed about me playing with that. It's not brilliant that there's movement in this right knee, and what that suggests is that either she's strained her cruciate ligament, which could lead to instability in this leg, or she's actually ruptured it. The cruciate ligament is a really important, very solid ligament that runs from the top of the leg to the bottom through the knee, and it gives the knee stability. In sports people, like netball players or football players that turn very quickly, that's when they can rupture and tear this ligament. All right, baby girl. All right, sweetie. There's some nice happy drugs for you, hey? Given a history, I just want to take some x-rays to look at the bigger picture to make sure there's nothing else going on. 1, 2, 3. Good girl. This is troubling times for both of us. I can't hide it. She sees it. But the great thing about Ellie is she's pragmatic. She doesn't want to put her head in the sand. She wants to know what's wrong with her dog and what she can do to fix it. And for that, I absolutely love her. So what I'm going to do is lift her up and you're going to slide that underneath her bum.
Okay.
Ready? Count of 3. 1, 2, 3. There you go. Lovely. Good job.
At the Richmond practice, Dr. Scott Miller is about to take x-rays to find out why Ali's 2-year-old boxer Cross is in pain from a chronic limp.
Great, that's beautiful. That's great. Okay, nice.
Mabel has a long medical history. Before her adoption, Mabel had already had surgery on a break in her left hind leg. Now the right leg has also become a serious issue.
Mabel is a genetic mess. As far as the pool of genetics, she's definitely swimming in the shallow end. It does mean that this is a long road. There's a lot of heartache in store for Ali, but I'm sure together we can surmount it. Just need to be in the room this time to take these x-rays, so the sun. It's a very fetching outfit, Ali.
Yeah, nice.
Yeah, what do you think?
It's longer at the front than the back. It's protecting your essentials, I guess.
Yeah. Not that I need protecting anymore. I'm definitely not having any kids, more kids.
Oh, yeah.
No way.
You said that last time.
No. I'm deliberately trying to keep the mood light because I know Ali well enough to know that she'll be absolutely terrified of what might be wrong with Mabel. She's thinking of all the worst possible scenarios, but let's hope that these x-rays will give us some simple answers and we can get this beautiful but problematic dog sorted out.
First, Scott looks at the x-ray of Mabel's left leg to check on her old surgery. Immediately, he has some disturbing surprise news for Ali.
What we didn't have was a fracture in the patella, so the kneecap has got a fracture in it just there. But that would hurt, and yet that is the leg that she is putting all of her weight on, because the other one has more problems than that. It just gives you an idea of how bad the other leg is, if that's the leg she's relying on.
Can it be fixed, that, or will it just heal?
It will heal given time. There is already a level of callus formation present there.
So it's been broken a while then?
It's been broken a while, yeah. Yeah.
Should I have noticed that?
I don't think so, no. How would you have? Because she's been flailing the other leg in the wind. There's absolutely no way that Ali, one of the most dedicated owners I know, could have picked up on the fact that her dog had a fractured kneecap. She couldn't have, because the dog literally is putting all her weight on that leg. And so, of course, anyone would focus on the leg she's dangling to her side, the right leg. It's fine, it's fine. It's honestly, it's fine. Don't worry, it's fine. It's fine. We'll get on top of this, we will, I promise.
So to see that and think, even a tiny fracture's gonna hurt, hasn't it? So, not enough to not put the weight on, I guess, but I still feel sad that she's in any pain at all.
That's not even the bad knee. I don't know why you're crying about that one. That's a good knee.
I shouldn't have known.
Oh, you couldn't possibly. You don't have X-ray vision, do you?
Now it's time for Scott to examine the X-rays of the troublesome right leg.
The right leg, actually, doesn't look too bad.
The X-rays have ruled out any serious bone damage, but what X-rays cannot show is soft tissue structures like a cruciate ligament. Scott is even more convinced about his diagnosis and will now refer Mabel to orthopaedic specialist surgeon Michael Hamilton.
If it is a cruciate ligament, we can get it fixed straight away and finally give Ali some peace of mind. Fingers crossed.
God, I wanted us to have fun, but now I just want her out of pain. God, get a grip, woman.
It's all right.
No, it's not. I'm fine.
Ali's as tough as they come. She's as tough as old boots, but she loves her dogs and they're her life. And the fact that Mabel is suffering, she's heartbroken.
I know, baby girl. Can't sleep forever.
In nearby Isleworth, there appears to be a delivery for receptionist Leah.
Hiya, what tortoise in for microchipping?
But in fact, they're patients. Tortoise expert Jason is bringing in 16 of his unusual pets for microchipping.
I've been waiting all day to see these.
Hi, Jason. Nice to see you and all of these little guys. Shall we go through?
That'd be great.
Great, I'll take these.
Tortoises need to be microchipped for a variety of reasons. Some species are kept outside, so they might go for a walkabout and get lost, or they may well be stolen because a lot of these tortoises are worth a lot of money.
It's going to be a challenging morning for Jo. Fortunately, she's being assisted by reptile lover Nathan.
So I can see they've got little dots on them. Is that how we tell them apart, or do they all have names?
Yeah, they have names as well. We've got one called Bowser, one called Daisy, one called Lisa, one called Marge, Mary, and I can't remember the other one's name. But this one here is called Bowser, who's the biggest and the greediest out of the bunch. And then this one's called Daisy.
Aww.
Jason has brought in 2 species of tortoises. These bigger ones are called golden Greeks.
Are these different or are they the same?
Yeah, those ones are pancake tortoises, what come from Tanzania and Kenya.
Okay.
And they're soft-shelled tortoises.
How big are the babies? Because they need to be 5 centimetres for us to chip them.
This is just over 6 centimetres, this one.
Great, so just big enough to chip.
I think they will be quite tricky. Some of them are just on the borderline of the size for chipping, but bearing in mind they do wiggle a lot, it will be quite difficult, I should imagine.
We'll start with the biggest ones, and if you want to take a seat in the waiting room, and then we'll let you know when we're done.
Lovely. Thank you very much.
Okay.
Thanks.
Let's start with Bowser, and we go on to the rest of them.
Okay. That's a fiddly job. In a cat and a dog, we've got a nice big scruff that we put the microchip in, and in a tortoise, we have to find the tiny little bit of skin in front of their leg, so it's a lot more tricky, and it'll get more difficult as we get down in size. That's done. Let's pop some glue on there. See the little hole there. Who's next?
This one's Sue.
Okay.
Tortoises have become trendy pets, but they cannot be imported or sold within the UK without special permits. There is no legal limit to how many tortoises an enthusiast like Jason can own, but they must all be microchipped.
Okay, 1 species down, 1 to go.
After completing all the microchips on the golden Greeks, it's time for Jo to really test her skills with the very tiny pancake tortoises.
You've got to be so careful doing these tiny little pancakes. Okay. Just as well Scott didn't do this. I think my fingers are smaller than his. There we go. Okay, now we have number 9. Should have given them names instead of boring numbers. What's a good name for a tortoise?
Go on, Joe, I'm sure you can think of something.
Sheldon? Michelle? So things can go wrong, which is why they need to be at least 6 centimetres. If they're too small, then we can go too deep. And worst comes to the worst, it cannot be implanted under the skin. It could go too far in and it can go into the actual abdomen. That would be painful. Let's just check in. Perfect. Last one done. Tortoise marathon is complete. Tortoises were lovely. I love the little pancake ones. None of them tried to bite us, which is fabulous. All 16 chipped, so they've got their unique numbers, and all their paperwork's up here, so they're all done.
OK, well, thank you very much.
You're
Thanks for all your
welcome.
hard work. Thank you. Bye-bye.
Bye.
Come on. Gently.
It's a new day in Ali's quest for answers about Mabel's painful lame leg.
Come on, sweetheart. I know.
Scott has referred her to orthopaedic surgeon Michael Hamilton.
Ready? In we go. I'm very hopeful Michael will find a solution. He's the expert. I'm not. Scott's recommended him. So, yeah, I'm really hopeful that after today, I'll know where we're going.
Okay. Good morning, Ali.
Hi, Michael.
It's lovely to meet you.
Hello. Nice to meet you.
So this is Mabel. Hello, darling. So, I've heard lots about you. Oh, she's gorgeous, isn't she?
I don't care if Mabel's wonky or limpy or a little bit odd, as long as she's out of pain. And I know she's in pain, so we need to fix it.
Should we go in then? Let's have a look. Go on.
Come on, sweet.
Go on, darling. Let's have a look. So as Mabel walks in, clearly there's an issue with this back right leg. She's got a very kind of straight ankle, which is not normal. I have some thoughts about these ankle joints. So this would be what is our heel bone.
Yeah, this is where we thought the problem was.
This bit here, that would be our heel bone.
Yeah.
You and I walk on the flats of our feet, like this. Dogs walk up on their toes. She's very, very, I mean, look at, this is a good leg. She's very, very straight on this leg. This conformation, this very straight-legged conformation,
won't have
potentially, yes, won't have helped. Now then, I have some news for you. She's ruptured her cruciate ligament. Yeah. Now, I'm going to show you a little test here. So I'm going to put my finger on the front of her shin.
Yeah.
I'm going to hold her knee still and pull up her toes.
Yeah.
And that, the way it pulls on the muscles, it kind of mimics weight bearing on her knee. Okay. This finger should not move. And that finger
is moving
forwards quite significantly.
Is it sore?
Is it sore? It's probably uncomfortable at best. It's painful in people, for sure. We see this very commonly in young, large breed dogs, but we can fix these very successfully. We're going to do a procedure called a TPLO, and that stands for tibial plateau leveling osteotomy. It's a very complicated sounding thing, and the analogy that I tell all these owners is, if you stand on an icy hill, you skid down the hill, and that's what Mabel's knee is doing at the minute. The bones are skidding around like this, and when we're finished, the bone is flat, and there's no hill, and the knee is stable, and the prognosis is excellent. It's really good, and we do hundreds of these, and they usually go back to normal function. She doesn't have much luck, does she?
No.
Yeah.
She hasn't had a lot of luck from the beginning.
No.
Really sweet. Till he found me. Hey.
I think we get her in today, we sort the cruciate out, then we see where we're at and we'll take it from there. Mabel has got a good attitude. I think she's going to be using that leg straight away. The problem that Ali might have is trying to keep her quiet, which in many ways is a nice problem to have. I'm going to take your pooch off you and stabilise her knee. Don't worry, she's going to be fine.
She'll be good for you, I know she will.
Oh, she's lovely, yeah.
She's no trouble.
No, she's lovely.
She's a sweet dog and she handles it with grace, really. So I owe it to her to just try and keep her fixed.
Right, Mabel, let's do it. You follow me, darling. Let's go this way. I'll see you tomorrow, Ali.
All right, then. Thanks.
Take care.
Slowly, baby. Come on. You're a good boy.
In Richmond, three-legged rescue dog Marcus is heading in to see Scott.
Should we go, baby? Come on, slowly.
4 days ago, samples were taken from a worrying lump on the Labrador's leg, and the results are now back.
Hello, Nina.
Oh, yeah.
How great to see you.
Yeah, me too.
Hello, Marcus.
Hi,
Gina, look at this guy. What a handsome fellow, isn't he? Hello.
Hi,
Say hi to Gina.
Oh, lovely.
Yeah.
Carer Nina has been helping to look after the Labrador since he was saved by a dog rescue charity.
Cuddles are over, mate. Me and Nina need to have a chat, so let's go into the consult room, shall we? Come on then, big guy.
Even though Marcus is very happy, loves his walk, loves being around us, there are a few signs that are a little bit worrying. He drinks a lot of water, he gets tired very quickly. I'm ready for the best, but I'm also a little bit ready for the worst.
I'm a little caught out by the result that we've got. We found some cells called spindle cells.
Right.
And spindle cells are the starting blocks of a type of tumour. And the worst case scenario is it can be an incredibly nasty tumour called fibrosarcoma, which can spread to all areas of this dog.
Do you think it has spread already, or will the cell just be in the tumour?
At this stage, I don't know.
And do we have a way to find out?
We do, absolutely we do. What we need to do is determine if the tumour has spread, where it's spread, and what type of tumour it might be. In this instance, the worst case scenario for a normal dog, you'd remove the leg. We don't have that option with him.
We don't. We can't do that, obviously.
I know and I can feel already how much of an impact this dog's made on you. So I know
He's
that-
wonderful, Scott. I don't understand. How can people give up on such a loving dog? I don't understand. Today is a very difficult day. I wanted to burst into tears, but I didn't want to show this emotion to Marcus because being so happy in front of me and not knowing what's happening, and I don't think it was fair on him, so I did hold on to my emotion and try to keep the happy face.
Scott will now take x-rays of Marcus to find out if the cancer has spread.
We don't know what's going to happen. Scott will soon come back with a verdict. No matter what, we will never give up. You need to be full of hope and you need to try. And this is where I think his kindness has paid off, because finally, with you, with me, with us, we won't let him down, no matter what.
You're damn right we won't.
There we go.
Oh, good girl.
She's a good dog. We've got the pre-med drawn up and stuff.
Yeah.
At Marlow, 2-year-old Mabel is about to undergo surgery on her ruptured cruciate ligament.
Sleepy boys. This is where you tell them to count backwards from 10. Count backwards from 10. And you're asleep.
Specialist orthopaedic surgeon Michael Hamilton will be performing the operation.
So the first part of the surgery is we're going to go into the knee joint to check this little thing called the meniscus, which is a little shock absorber inside the knee joint. So we've got to check that, because if she's got a torn meniscus and we leave it alone, she's going to stay sore. Okay, so off we go. Huge, big torn meniscus, look at that. A torn meniscus is really, really painful. People describe that as a really, really sharp pain in the middle of your knee when you try and stand on your leg. So this should be a lovely, shiny, quite robust piece of white, shiny cartilage, but it's been flipped forward and it's been crushed by the bottom of the femur. That is a painful thing. So 90 degrees from the long axis for you, Ollie? Looks good to me.
Yeah.
What we're going to do now is the nuts and bolts of the procedure. We're going to actually make the top of the tibia, which at the moment is on a slope like this. We're going to make a cut in the bone and we're going to move it such that it's flat, and we're going to stabilise it in that new position with a plate and screws. So last screw. Okay, so plates on, looks good. Leg looks nice and straight. Just check his alignment, looks nice and straight. Happy with the plate position. Most importantly, have we done what we sought to achieve? There's no movement there now. That is a nice stable knee. So we're gonna close him up and then we are done. Do you know what? I love this operation. They come in and they're really, really sore, and literally within no time at all, they're not. Love it. It's quite a bold statement to tell owners, I expect your dog to make a full recovery, because not all of them make a full recovery, but the vast majority of them do. And that's what I'm expecting with Mabel. Okay. I might just get in here with her, I think. There we go.
Michael will decide later this afternoon if Mabel's recovered enough to go home with Ali.
Okay, get well soon, darling. Right, okay. Oh.
Look at this guy.
Oh, hello.
This handsome fellow is Marcus.
Hi, Marcus.
Hey.
In the treatment room at the Richmond Clinic, head nurse Emma is about to join Marcus's growing fan club.
Honestly. Oh my God, look at him. I know you said you were bringing me a new man that I might fall in love with, but
There you go.
yeah.
Isn't he gorgeous?
Test results have confirmed there are signs of cancerous cells in the lump on the Labrador's leg. The lump needs to be removed, but Scott will also take X-rays to find out whether there's any sign of other cancer cells throughout the rescue dog's body.
Thankfully, he's incredibly oblivious. Aren't you? You just love all the love and attention.
Oh,
you don't care. You don't care. Yeah. Oh. Yeah, and just all the rest of us feeling very melancholy.
Oh, you're such a sook. Look at you. Hmm?
What we need to do is do various X-rays in order to determine if the tumour has spread, where it's spread, and what type of tumour it might be. Whatever God or not you pray to, let's just pray that this dog is going to be okay.
Really need the lights off.
That's it.
There we go.
X-ray.
With Marcus's foster carer Nina waiting nervously upstairs, Scott and Emma are about to look at the chest X-rays.
Is this just normal?
Yeah, there's no tumours we need to worry about there. It's all looking pretty healthy. Okay, good. Let's move on to abdominal X-rays then.
It's good news so far, with the chest clear of tumours, but they also need to check the spleen, the area that Scott is most worried about.
Generally, this type of tumour will spread to the spleen. But so far, so good. That looks like a nice, beautiful, healthy spleen of a beautiful dog. So that's good. So I'll go and give Nina that good news, and then you can get set up for taking the lump off.
Will do.
There isn't any presence of cancerous lumps, so that's really great news, and it does mean that at least at this stage, the cancer hasn't spread. So no tumours I can see, all right? So nothing in the chest, nothing in the abdomen. What I need to do now is to actually move forward to surgery.
Okay.
And I'm going to be taking the lump off.
Brilliant. Oh, I'm so happy. Oh, I'm so happy. It's brilliant. Very good news. Thank you so much, Scott. Thank you. Good luck.
Thank you.
All the best.
But while Nina is feeling more positive, Scott is well aware Marcus is not out of danger yet.
This is a rocky road and I don't know where it's going to go, and I only will know once I actually remove the mass.
Come on, Sasu. Where is she?
For Mabel, however, it's time to go home. The boxer cross has made a quick recovery from the surgery to fix her ruptured cruciate ligament.
Hello, Ali. How you doing?
I'm all right. How is she?
She's all right. She's all right. Yeah, come on through. Come on through. She'll be pleased to see you.
Owner Ali is ecstatic to be reunited with her 2-year-old and hoping that her worries are finally over.
Hello, darling.
There she is.
Hello. Hello, monkey face.
She's been great. She's been really good. Wish her all like that.
Is she in a happy place?
She's in a very happy place. Oh, is it? It went really, really well. Her cruciate was completely ruptured. Her meniscus, the shock absorber thing, was badly damaged as well. No surprise. So that's been taken out. The knee is now stable.
Mabel can be started on a gentle exercise program of 10-minute walks from tomorrow.
She's already putting a little tiny bit of weight through the leg, which is what we would expect with this op. So, yep, there you go. There's a lead.
Okay.
Pop that on her.
Brilliant. Thank you.
It's my pleasure. It's my pleasure.
Thanks. Michael's done a great job, as I expected him to do. I mean, he was recommended by Scott. I trust Michael. You know, he's a northerner. He gave me straightforward answers to the questions I asked him. So, yeah, how can I not trust another northerner in the south of England?
She's under the influence, so I hope she's not driving.
Come on, then.
So, right, off we go.
Come on.
It's a lovely feeling when we see the owners reunited with their pets, particularly when we've done a procedure where the prognosis is so good. Come on, darling, up you get. 1, 2, 3.
No messing about.
Come on, 1, 2, 3. 1, 2, 3. Oh, up you go.
Girl.
Nice and slowly. And you'll see her getting better every day. And if she doesn't, let me know. Mabel came in, hardly using that leg and quite painful. And, you know, give it a few weeks' time, she's just going to go from strength to strength.
Come on, that's it. Good girl. This way. To the car. That's it. Good girl. I can't wait to get her home. She'll relax a lot more when she's there. All her beds are waiting, her tea's cooking. We just need to get her home where she's loved. What a good girl.
Sizable, I'll give it that.
The operation to remove the large tumour from Marcus's leg is about to begin.
It's quite a sizable mass, this. It's very, very vascular, which means there's a huge amount of blood supply to it. And generally, cancers can be quite greedy. They like lots and lots of blood to grow and do their evil pursuits.
Because of Marcus's excessive bleeding, Emma is using an electrocauterizer. The superheated tip of the probe seals the tissues and blood vessels, helping to stop the bleeding.
This tumour is a horrific, ugly, nasty-looking thing. It's the definition of what you would expect cancer looks like. This thing is stuck firmly to the skin on this side. So to remove it completely is going to prove very difficult. I know I'm not going to be able to remove the whole thing. It's impossible. I'd have to take his leg off, and that we know is impossible. So I'm just going to take as much as I can, hit it as hard as I can, and hope for the best. Get out. Get out.
Back in Richmond, Scott's struggling to remove a huge tumour from rescue dog Marcus's leg.
This tumour is a horrific, ugly, nasty-looking thing. It's horrible and it's invasive. It's going deep into Marcus's leg.
With the abandoned Labrador already having to manage on 3 legs, another amputation is just not an option.
Normally in potential cancerous lumps, you have to remove around 3 centimetres in all directions. Well, if I take 3 centimetres in all directions, he loses his leg. But he can't lose his leg because he's already lost one. So I'm just in a very, very difficult situation where all I can do is try and remove as much of the tumour as I possibly can, and then just hope like hell that the result comes back that it's one of the less nasty ones. Really a bit of a half-assed job, and that is not my happy place. Okay, here we go. Yeah, it's pretty grim, isn't it?
That's absolutely foul.
That's disgusting.
This does not look nice, so I am concerned about Marcus's future, but I need to hold fire on my concern. I need to be there for Nina through the process. We'll send it off to the lab, and fingers crossed.
If Marcus is lucky and the tumour turns out to be a low-grade cancer, the Labrador has a good chance of survival.
I mean, I still have hope that we'll get a result which means that he will live a number of happy years, but we just need to be patient and be prepared for the worst as well. So it's going to be a tough wait.
Yeah. Today is a very difficult day, but I have to hold on tight about the fact that no matter what, we will do our best to give him that quality of life. Will it be a month, 6 months, a year, 2 years? I have no idea. But during that time, for sure, he will be cared for and never, ever found himself abandoned again. You've got a nice bed waiting for you. And I know someone who's going to sleep next to you tonight, and that's going to be me. Just to make sure you're okay. Yeah.
It's time for Nurse Emma to check if Hazel the hedgehog has had any luck with her battle of the bulge.
She definitely looks a little bit smaller.
Fingers crossed.
Fingers crossed. Let's have a look, shall we? Come on. Last time we saw Hazel, she was a little on the larger side, so we're hoping that she's lost a bit of weight today.
At her last weigh-in, Hazel tipped the scales at 0.63 of a kilo.
Moment of truth on the scales. Come on, you. 0.58 kilos. Fantastic. So she's lost 50 grams.
That is great.
That is absolutely incredible.
I'm just really proud of her. Just giving smaller portions and changing some of her snacks for less naughty snacks. She's responding really well, and I just feel she's done really good.
Little high five. High five. Yeah. Oh, that's brilliant.
Yeah, good boy and good girls. We've got a really good dog here, haven't we?
As for Marcus, he's loving all the attention he's getting with his foster carer Nina and her two other dogs, Sadie and Django.
Do you like your new friend? Yeah, is that nice? Is that fun? Oh, little sweetheart, we need your bandage off. Then you'll be fine. Ah, no.
It's been 3 days since Scott removed a nasty lump from the three-legged Labrador.
Sit.
The results have just come back, and tests have revealed that the tumour is a low-grade sarcoma cancer. But while it's malignant, it's not aggressive.
There is a big chance that it might regrow in the same area. And if we have to remove the tumour again, then we will do. But the chances of it actually spreading to other parts of his body are really low, and so that's really good news for the future of Marcus.
Wow, what a nice ball you've got. Django, come on bring your ball, slowly, slowly.
And that's not the only good news for Marcus. He's going to stay with Nina and her family for the immediate future.
Obviously, we hope for the best and we will see what happens, but for the moment, for sure, he's really happy and he's fine. You are doing very, very well. You're getting better by the day.
Slowly, sweets.
And 6 weeks after the operation to fix her ruptured cruciate ligament, Mabel's out of pain and back to her boisterous self.
The last week's been noticeable in her spirit. She's been shoving toys at us and desperately keen to play. Good girl. I'm glad I did it. It had to be done. But what I am glad about is how well she seems to have recovered. Mentally, she's ready to go. Physically, you know, the surgeon's really pleased with the results at 6 weeks. So, I mean, I couldn't be any more pleased.
Yeah, she's looking great, isn't she?
Isn't she?
Today, Scott dropped by to check on Mabel's progress. After the long journey with Ali, he couldn't be happier.
She's walking really pretty well. I mean, 2 good amounts of weight on both legs.
She's using it all the time.
And you feel that's getting better and better each day?
Oh, definitely.
It's always an absolute treat to see my mate Ali outside of the practice, but even better to see beautiful Mabel. And the fact that she is walking so well and looking so happy and so comfortable, as close to a normal dog that Mabel will ever get, is great news.
To other people, she'll look like she's got a limp or she's not right, but to me, I know that's as good as it ever was.
Yeah, and it can still get better.
Yes.
Great.
All the arduous tasks of lead walking only and building up the time and everything, it's paid off. Hopefully in another 6 weeks, she'll be off the lead and it'll all be a distant memory.
Come on.
That's it.
Hey, you can walk now.
I love her to pieces. I think she's got a face that only a mum can love. She's not, you know, loads of people think she's ugly. I think she's beautiful. She doesn't have a bad bone in her. I know she's not human, but she is my little baby girl.
Come on, Mabel.
Come on.
Come on. That's it.
Get a wriggle on. That's it. It'll be arthritis next. It'll be the elbows time. Yeah.
Yes. Yeah, should I book you in for next week already?
I think I should have an annual slot.
Cats and Margarets, worried owners Emma and Echo have rushed down to the practice with their 11-year-old cat Spuddy.
So, I hear this guy's gagging and retching, is that right?
Yeah, he hasn't eaten for the last 24 hours, but he can't even drink milk at the moment or, water.
All right, in a bit of distress.
I mean, I don't know how relevant this is, but he did eat a very large mouse last week.
Spuddy's the sort of cat that does tend to be sick quite often because of all the weird things he eats. I mean, usually he just coughs something up and then that's the end of it. But this time it just kept going on, so we rushed him down.
So if I get you to hold both of his front legs with your 2 hands.
Okay.
All right, mate.
He's got the sharpest claws.
So unfortunately, I can't see as far back as I would like to because the tongue, he jams it up into the top of his mouth. So what I think we're going to need to do is knock out your boy and have a good look down his throat.
Sure. Okay.
Because my feeling is that we're going to find something that shouldn't be there.
Yeah.
I think what concerns me with this case is that Spuddy Boy normally eats for England, but he has just stopped eating, he's stopped drinking, and now he's gagging. So he's clearly having some issues with his ability not only to eat, but also breathe, and that's a major concern. All right, will you say goodbye to your boy?
Hi, Spud. He's very important in our lives. Yeah, we're very fond of him. We're very fond of him.
Hey.
He's got some very sharp nails, so watch yourself.
Oh, lovely. Look at them talons.
Head nurse Emma is helping Scott find out what might be stuck in Spuddy's throat.
What do you reckon it is?
It could be anything from a grass blade to, material, string, all that sort of stuff. All right.
All right, buddy.
Yeah,
okay, good boy. Oh, it's a bit scary, isn't it? We're all right, buddy. These things with cats, with any animal, are what we consider emergency procedures. The fact that he can't really swallow, he can't eat, he can't drink, we class that as an emergency. So hopefully Scott will be able to find something relatively easy and get him into recovery.
So at least now with him asleep, I can see down the back of the throat, I can see his larynx, it's all fine.
All right, buddy.
Ooh, what's that? Oh, I've got it, whatever it is. Oh, what the hell is that? It's absolutely massive. My goodness. Look, it's still coming. Oh my goodness, look at that. Oh, mate.
Buddy.
It's amazing to see a 3 or 4 inch long bit of grass. Absolutely unbelievable. And you can just imagine how infuriating that must be to be stuck in your throat. Awful.
It's massive.
So what he'd done is he'd swallowed it and then he coughed at just the wrong time and it's gone whew, up into his nose and it's just been going backwards and forwards and backwards and forwards. So he sneezes and it goes up and then he coughs and it goes that way and it just keeps going backwards and forwards around his soft palate.
Oh, bless him.
But look at that. I mean, think how massive that would have been in his tiny little nose. Not so much the mouse tail that Mummy thought it was going to be. That is a ripper. This type of procedure, when they have this sort of foreign body, is actually really rewarding because the cat is significantly unwell. You quickly and deftly treat it, you find what's causing the problem, and they go home and they're happy.
Hello. Hello.
Look how big that is.
Oh, that looks horrid. Oh, and sharp and pointy as well.
And long. It's horrific.
Yeah, no wonder he was in such discomfort.
It's not the best of dishes for you, I think, my friend. I think you need to stick to those mice.
He seems like he's back to his old self. So.
Yeah, he seems completely fine.
Bye, girls. See you later.
Thank you.
Thank you.
All the best.
Thank you.
Bye. Well, it's a good result for Spuddy, but this little emergency has really put me behind schedule. Today I'm off to Wales for something completely different and I really need to get on the road.
Scott's taking a break from his 3 practices and heading to the country for a working holiday. After making London his home for the past 18 years, the Australian vet is exploring another possible move.
The idea first came up when a client of mine mentioned that they had a relative that runs a big rural practice in the beautiful green rolling hills of Wales. Now, I have always had a bit of a daydream that one day I'd pack up the family and head to a completely different environment, somewhere with clean air and wide open spaces, and become a country vet.
So Scott's putting the dream to the test, working at a local practice in the historic town of St Clair's for the next few days.
I'll be the first to admit that I'm going to be completely out of my comfort zone, and I'm pretty nervous. It's been a very long time, pretty much since my university days, since I've seen the business end of a cow or a horse. So it'll be very interesting to see if I can convince the locals that this city slicker's got what it takes. Up to you.
Thank you.
Hello there, ladies. How you doing?
Good, how are you?
Good. I was actually trying to work out how to say hello in Welsh. How do you say it?
Hello.
Oh, so you just say it with a Welsh accent?
Yeah,
Keeping
it simple.
Yeah, well, you definitely need to do that for me.
Welcoming Scott to this country vet practice are Fionn and Ang Harrod.
I'm supposed to be seeing the boss. Whereabouts is he?
Straight through there.
Wish me luck.
Good luck.
Hi there, David.
Hi, you must be Scott.
Yes, I am. How you doing?
Oh, so pleased to meet you.
And
welcome.
you.
Yeah, welcome to beautiful Wales.
Thank you very much.
Today, Scott is reporting to one of the practice's head vets, David Stark.
So we've got a busy day on farm, so I need to get you some proper gear.
Not my usual kit, I'll be honest, but look, I'm happy to get stuck in with the farm work.
Right, let's get you kitted up and then we'll crack on.
Sounds good.
Good.
Forget any notion of lazing around watching the grass grow in sleepy old Wales. We're into it straight away.
First up, David has an interesting challenge for Scott at a local farm.
Good girl. Up you go.
This should be 51 days.
This beef farm is run by 4 very independent Welsh women.
There are 3 generations here, my grandmother and then my mother and aunt and I. Everybody has an opinion, but as long as we get there in the end, that's the important bit.
Hello there, ladies.
I'm Virginia.
Hi, Virginia.
Hi, Marco.
An unsuspecting Scott is about to find out what the Roberts ladies have in store.
I'm feeling a little bit of intimidation with you 4 already. Do you normally feel like that when you come here, David?
Oh, I've got used to it over the years.
Have you? You got used to the girls?
I'm acclimatised.
Right. So what have you got me here for today?
We've got a pedigree bull, so we need you now to have a look at him to make sure that he's fit for breeding.
All right, well, shall we unleash the beast?
Let's go. If he's used to smaller animals, seeing a bull is going to be totally different.
I'm very worried about seeing this bull. I'm sure he's an absolute giant.
Bulls can be a bit aggressive, they can be dangerous, so I think we've got to be careful in this situation.
Oh, great. It's tiny.
There's the bull, there he is.
I was expecting something this high.
You'll grow into a big bull eventually. Let's go down, let's go look at him, Scott.
Hello, boys.
Luckily, Scott's first patient is a young bull called Merlin, with his mate Colin keeping an eye on the visitor from the city.
If you look carefully, you'll see he's got a tremendous hindquarters. He's really well built. And so that's why they feel he has potential as a bull.
So what you're saying is that he's got a bigger bum than the other one. And from a beef cattle perspective, he's going to pass it on to any offspring that he has, which is also
That's right,
very
yes,
positive.
and produce very good beef calves as well.
But looks aren't everything when it comes to breeding.
Dave and I commenced the examination of this bull from head to toe to make sure he's up to scratch and he's going to be a good dad to all of the Roberts family's new calves.
He's got a lovely temperament.
Yeah, I can tell. Yeah, he's
Good boy. He's just very strong. He's a very strong animal. But otherwise, he's lovely and quiet. You can handle him quite nicely. We'll just check his teeth, see what his teeth look like in his mouth.
Yeah.
Good alignment of the teeth with the upper jaw. Would you like to have a turn and examine him? Have a look at him?
Yeah, sure. This bull is maybe not as big as I expected, but it's certainly bigger than all the patients that I treat in Richmond. Good boy. Are they like dogs and cats? Do they respond to being talked to?
Yes.
Yeah, definitely.
Yes, they do.
Definitely.
Oh, there you go.
They know your voice.
Oh, hello. You probably haven't heard my accent before around these parts, I wouldn't have thought. Hey. G'day, mate. How's it going? Hey? Hey, you're a handsome fellow. Nice, incredible. Incredible to look at these beautiful brown eyes close up. Very nice.
Right, let's check his height.
Yeah. Good boy. Good boy. My initial impression is that it's running faster than I thought it was going to be.
But just same with dogs and cats, the younger they are, the faster the heartbeat.
Yeah. His eyes seem good, his heart seems good, everything else is looking very, very good. But at some point, I know I'm going to have to go
to the business end. All right, Merlin, I promise to be gentle.
If the bull hasn't got good testicles, then he won't be able to work as a breeding bull. Getting nice and close to him. Okay. Grab both testicles. Get a nice firm grip there, Scott. Well, Scott's definitely got his hands full, but he's got great technique. Feeling good?
They're very firm. They're very impressive. I feel myself blushing. That's a nightmare.
Merlin the bull likes his scratches and he likes to be with people. Obviously, they're bonding.
Good, just check them for symmetry and size. Check for any lumps and bumps. And they're of a good size for his age. Everything feels great.
They do feel great. Ladies, I think that your bull, hopefully, he's got the equipment suitable. He's ready to go. I think the Roberts family are going to be very happy to know that their bull's up to the job. I'm just not quite sure that I am. Okay, big guy. There you go.
Job done, but there's still plenty more to come.
This farm stuff's hard work.
It's day 2 of Scott's working holiday in the Welsh farming community of St Clair's, where he's exploring the idea of one day becoming a country vet.
Right.
Ready to crack on?
Yeah, absolutely.
Today, he's up early, helping out head farm vet David at a local dairy farm.
David obviously is the lead vet here. He's the man that knows what he's doing, and I'm the humble pupil.
Yeah, I've got one for you as well, Scott. We'll get the scanner out for you now on the front there.
Scott and David are using mobile ultrasound equipment to check which dairy cows are pregnant.
It's a very interesting kit. It looks straight out of Star Trek kit. It's basically just an ultrasound. The same thing that we would use in our clinics back in Richmond, but this is designed for internal use. And I'm not very much looking forward to where I'm going to have to put it.
Have you got an image?
Oh, wow, yeah.
Cool.
Yeah,
Good.
so that's the ultrasound scan image I can see right in front of me.
That's right, yes. Okay,
All right.
let's go.
I'm actually feeling surprisingly nervous, way more nervous than I ever expected that I would. I'm an experienced vet, but not experienced when it comes to large animals. So I feel like I'm almost going back to school. Morning, girls. How you doing? I just hope I'm up to the challenge. All right, so here's the first lot of patience for the day. In you go. Good girl.
Waiting patiently in line are 40 cows ready for testing.
Hello, ladies. I promise to be gentle. It's really important that every cow on the farm gets pregnant every year. If they produce a calf, then afterwards they can produce milk. It's just like when you're a mum, you only produce breast milk once you've had a baby, and the same applies in cows.
I'm just going to scan the first few cows.
Yep.
And if you just watch to see what I'm doing, and then later on you can have a turn, have a go, right?
All right.
So we're going to use the scanner to see if they're in calf. Just put get the probe in it.
Most of the time, these girls have a lovely time eating grass in the beautiful Welsh fields. And the farmers, of course, keep very close tabs on them. But every now and again, they do have to get them in and do medical procedures on them. It has to be done, but hopefully we'll be as gentle and as kind as possible.
Good again. Mark with chalk. Mark a blue when she's in calf. So you know all pregnant, all the blue cows are in calf.
I've got a nice blue tail.
That's right. Nice blue mark on the back.
Okay, next.
So you got to watch them because they will barge on.
Yeah. I'm like a cow bouncer.
That's right. You're doing a great job there.
Thank you very much.
Now it's Scott's turn.
I know that Scott will find it a challenge. And just putting his arm into the cow, it's a whole foreign environment. And I think he's really got his work cut out today. I've scanned and I've checked her. So we'll now give you a go and see what you can find in the cow.
Okay.
So you all ready?
Yes.
Is the scanner turned on?
It's definitely on, so at least the equipment's right. I can't blame the equipment.
Okay, good. Let's see how you go.
It's been such a long time that I've worked with cows, and so I really want to make sure that I don't embarrass myself too much. I'm totally put off by the sound effect she's giving me there. That's pretty impressive.
Go on, get on with it, and we'll see what you find.
Okay, I'm going in. So, oh man.
That's an experience I haven't had in 17 years. That is, oh man.
I'll be quite happy if Scott can just find the womb initially.
Is it in the top left-hand corner of the screen? Would it be there?
If he finds a pregnancy, I'll be really pleased.
What can I see in here? Okay. I'm trying to find her uterus.
Just scan left and right, move the probe over the womb, just left and right.
It's absolutely amazing to be able to use an ultrasound like this in the field. Oh, wait a minute. What's that?
I can tell from Scott's expression how he's getting on. And initially I can see he's really concentrating, he's focusing on what he's doing. And then eventually you can see his eyes light up.
Oh, wait a minute. There we go.
And you think, wow, that's the eureka moment. He's seen something wonderful, great, fantastic.
Okay, teacher, please tell me, I'm pretty sure this girl's in calf.
Yes, she is in calf. Well done, Scott.
Oh, thank God.
She's in calf, she can go. And then, of course, you have to move on to the next cow, and the next, and the next, and you have to do it all over again. But so far, he's doing great. We'll make a farm bet of you yet, Scott. Welcome to Wales.
Oh, mate. This is an incredible experience. It's so out of my comfort zone, but also really exciting and interesting and different. I've just got poo on my lens. I've had a poo accident. That's nasty. And now I'm covered in poo. How can I wipe that off? David, I just need a nurse. Do you bring nurses?
No, there's no nurse.
No nurse?
You are the nurse. You're the vet and the nurse.
Excuse me?
The local practice is based in the nearby town of St Clair's. As well as handling farm animals,
I just have a little listen to his heart.
it also looks after many of the town's pets. Later today, Scott will be coming in to lend a hand.
Come on. You've got to go in to see the vet, my darling.
But right now, long-time resident Joyce is arriving with her Bichon Frisé toots.
In you go.
Hello, Joyce. Can you out?
Very good, Joyce.
Is it Toots you've got with you?
Yeah, Toots.
Oh, you to see Joe, is it?
Yeah. He's just a big softy at heart. Yeah, we've had him now for 8 years and he's been a big part of our life.
Lately, Joyce's companion has been suffering a painful bladder infection.
He's uncomfortable when he's passing water and he goes off his food and he ends up with a temperature. Just hope that there's nothing too drastic.
Hi, Joyce. How are you?
Hello there.
Hiya. Do you want to come on in?
Yes.
Vet Joe is part of the small animals team and has been treating Toots with antibiotics. But the infection isn't clearing.
I can feel he's a bit tender still when I feel on his bladder. So definitely that's still the area that he's sore in.
Yes.
We were a bit suspicious there might be something else underlying, that's causing these infections to recur.
I think what we need to do now is just take it to the next sort of stage of diagnostics, so to try and work out what's going on. And the best thing for that is going to be to do an X-ray.
Okay.
And go from there then, all right?
All right. You're going to behave yourself. Are you? See you later, baby.
Brilliant. Good boy.
There's a good boy. I'm just hoping that they don't find anything drastic. So you think the worst all the time, don't you? So we've just got to wait and hope for the best. And that's what I'm doing at the moment.
Good boy. Hi, Lawrence. This is little Toots.
Hi, handsome.
Vet nurse Lauren will be assisting Joe with the X-ray of Toots's bladder.
One of the concerns would be bladder stones, so crystals or little stones that form in the bladder itself. It could be a bladder tumour. Obviously, that would be sort of worst case scenario. But really, we need to rule out the stones as a priority.
Oh, my goodness.
Oh, wow.
I think we can see what the problem is.
Before heading back to the practice's headquarters, Scott is on another assignment, this time with local equine vets Philip and Kim.
Philip mentions about the fact that there's a foal hernia. Now, I haven't done horse surgery since university, so I'm incredibly nervous. I hope I can help, and I hope that Philip has faith in me. Hello.
We're going to send you up the paddock, pick up the foal, and Kim and I are going to start setting up in the barn.
Okay, I'll get the foal, you get prepped.
That's right.
Sounds good. All right, see you in a bit.
Right on, okay now. Normally I do these things on my own, so it'll be quite novel to have an extra pair of hands there.
You don't know what you're in for, do you? That's my coat you got hold of. Don't pull me over. Don't pull me off. He's naughty. Let go.
Waiting for Scott is horse breeder Di, with her mare Misty and her cheeky foal Freddie.
I spent a whole lifetime with horses. I don't think I would want to live without the horses. They mean everything to us.
Hi there, Di. How are you?
I'm very well,
Lovely
thank you.
to meet
Getting
you.
a bit wet, but there we are.
A little bit wet, a little bit windy, but there we are. We're in Wales
We can't
in a
help
field.
it, can we?
Today, the 5-month-old is having much-needed surgery to repair a large umbilical hernia.
Yeah, you can see so clearly that hernia. It's a decent-sized one,
It's
isn't it?
nasty, isn't it?
An umbilical hernia is basically a hole in the abdominal wall where the muscles haven't closed after birth. And what happens in Freddie's case is that the abdominal contents will leak out through the hole and lead to a bulge under the skin.
I promise I'll look after your boy. I will.
We've all made that promise to her, haven't we, girl?
Okay. Come on, Freddie. This is all about you, mate.
The real danger in Freddie's case is that his intestines can pop through that hole and then their blood supply is affected. And literally, Di can walk out into the field one morning and find Freddie dead. So it's crucial that we perform this surgery today.
Good, Misty. Good boy, Freddie. Good lad.
Misty's there, so it's comfort for him. Once he's under anaesthetic, he won't know what's going on. But all the time, Mum's there. If you take Misty out, well, then he can get upset.
Come on, Freddie. Good boy.
They're like children to us. You know what can happen or can't happen. You hope for the best, obviously. But there's always that element of doubt.
In the barn, Philip and Kim are preparing the makeshift operating theatre.
OK, I think we've got everything else here, so, yeah, basically we're good to go.
And it's not exactly what Scott's used to.
Come on, Freddie. Guys, I've got your patient.
I walk around the corner into the barn and it's a little rustic. I can't see any shiny lights. I can't see any steel. It is a shed full of hay and we need to do surgery in it. Different.
So, Philip, I was going to have a quick feel before
That's
we...
right, yeah, because it's quite nice to know now exactly what we're dealing with and how big the actual opening into the abdomen is.
So I can get 2 fingers into the hole.
OK.
Definitely bigger than the hernias that we feel on little dogs and cats back in
Oh,
Richmond.
yes, I'm sure. Yeah, that's right. Scott can extrapolate what we're doing back to his own animals in his own surgery in London, and the actual techniques are the same. It's just the scale that changes.
Wow. It's like a javelin.
Bigger than what you're used to.
Scott's first task is to place the large IV catheter into Freddie's neck in preparation for the anaesthetic.
Just hope I get it in the right place.
Good boy.
But finding a vein on a flighty foal is never easy.
No. Trying to place an IV catheter into a horse, a massive different world.
Where's your blood vessel gone, mate?
We did our absolute best to get it in as calmly and as safely as possible, but this is a young horse, and horses can sometimes react erratically, and vets can get injured as a result.
Good boy, I know.
I think we can see what the problem is. So that's his bladder there then.
Yeah.
And my goodness, can you see how many stones he's got in?
There's tons.
In the Welsh town of St Clair's, local vet Joe and nurse Lauren have discovered the source of 9-year-old Toots's bladder infection.
1, 2, 3, 4. I can't even really count them, to be honest. It looks like gravel. It's full of stones, much more than I'd anticipated, really, and definitely why he's had so many infections and also why he's been so uncomfortable, the poor boy. I just stuck to the bladder wall. And then there's a couple, you can just see a couple more just in his urethra coming out there.
Bladder stones are caused when high levels of minerals build up in urine, forming painful rock-like crystals.
When you've got an awful lot of them, any little bits can go down into the urethra and get stuck. You can actually get a blockage in the bladder, and that's much more of a concern. Hi, Joyce. Do you want to come on through?
Left untreated, the bladder can rupture, which can be fatal.
He has got quite a lot of stones in his bladder then.
Right.
Yeah.
So what's the next stage now?
I think they're quite small, but because there's so many of them, I think the only thing we can do is surgery.
Right.
Go in, flush the bladder through and take them out.
How soon are we looking at?
I think we can do it today. Yeah.
Right,
Straight away now. Sooner the better, really.
Yes, because he's
That's it.
feeling it, aren't you, baby?
Aww.
With so many bladder stones to remove, Scott will return to the practice to help Joe with the surgery later today.
I think Joyce is quite anxious, obviously, especially now that we need to go to surgery. But I think part of her, she knew there was something else going on, so it's a relief sometimes just to get a diagnosis. And hopefully this is something that we can control.
Okay, be a good boy. You always will think the worst, and there's nothing you can do about that. So just go home now, cup of coffee, and start chewing my nails. See you later, baby. Bye. Hopefully, this will sort it out now.
On a nearby farm, tension is high as Scott and the team prepare to anaesthetise 5-month-old Freddie.
Whoa, 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 whoa. Yeah, that's in. Good job.
Phew. Gosh, and that's the easy bit.
Scott is assisting local vets Philip and Kim with repairing the large umbilical hernia protruding from the young foal's belly.
Right, so I'm just going to inject the ketamine into his vein.
Okay, we'll see on the other side.
But right now, their greatest concern is making sure Freddie doesn't injure himself when he falls.
So it's really important that we're in a safe place. They're so heavy and if they go down in the wrong way, they can catch you out, and you just need to have your wits about you, really.
Okay. Good lad.
Come to you, Scott.
Yeah. Oh, that's a good ball. Oh, what a good boy. You're right there, mate.
Stuck in the straw. Right.
Once the laughs are over, once Philip's managed to regain his footing, we have to crack on with the surgery.
So next stage now, we will roll him onto his back. Roll him up. Okay. We just crack on and get ourselves scrubbed up and ready to go.
I've done countless umbilical hernia repairs in dogs and cats. That's bread and butter for me, but this is on a bigger scale completely with an animal that can kick me in the head, and then I'm being watched by Philip. Quite intimidated right now.
You'll be fine. You will.
Keeping vigil nearby is Freddie's owner Di and his mum Misty.
Nervous now, very nervous. I'll be glad when it's all over. He's up and with his mum.
Right, now, so I'm going to click my initial incision up here. So we should be far enough away from anything dangerous. Surgically, the main risk is that we could damage the intestines as we're going in. And also when we're putting the sutures in place, there's always the risk that we could actually accidentally catch part of the intestines, and that can cause quite serious problems. Well, there we are. So we've got bowel there straight away.
That was just millimetres underneath that sac.
That's right, so we didn't want to damage that at all.
Well, that could lead to all sorts of complications like peritonitis and even death if you nick that.
Yes, we nicked that. It's just like having a burst appendix, really.
If you nick in the intestine, then the horse can get a massive infection called peritonitis, and they can die from it. It's exceptionally painful. It's an absolute nightmare. So it just shows that this procedure is actually a very serious one indeed.
And now that we're in there, the actual hole is a lot bigger than what we could feel on the outside.
That's amazing that intestine pops out so easily like that.
Yeah.
Wow, it just shows how important this surgery is.
Oh, yeah. Basically, a strangled hernia is where some bowel comes out and the blood supply to it is cut off. Then the animal can be brought in, and then an emergency op, if you're lucky, or a dead horse in the field if you're not lucky. Right, I'm happy with that now. Okay.
With the intestines back inside the abdomen, Scott is carefully closing the hole with sutures.
Got you in the finger.
That is my finger, yeah.
Oh,
I'm aware of that.
That would have been instant dismissal.
Oh, this is a treat for me. I don't usually have another pair of hands in here on this job.
Happy to help.
Yeah. That's lovely. Okay, good man. I think Scott is doing very well. Although he hasn't handled horses or large animals since he left college, he's got his good surgical skills. That's it, it's gone.
Nice, neat tummy, all tight for show jumping.
That's right.
With the operation complete, everyone is now anxiously waiting for Freddie to wake up.
Okay, Scott, take the leg.
Yep. Good boy, Freddie. Good lad.
This can be a really dangerous time for horses because they can react erratically. They're very strong, and so he can go from being an animal that's just been fixed to an animal that's very easily broken.
Come on.
Mummy's just over there. Good boy.
It's almost over now, so hopefully he'll get up and be a bit wobbly, but then Mum can look after him. Everything will be all right. That's fingers crossed.
Oh, no, maybe not.
There we go. Up you get. Come on, buddy, you can do it.
There we are. Lovely.
Good boy. Freddie takes such a long time to wake up, but slowly he comes right. Look at him struggling towards Mum.
Yeah, I think he wants a feed, doesn't he?
He wants a feed.
He wants solace.
And that's an absolutely glorious moment. It's a real relief to see him up and then suckling from his mum. Absolutely beautiful. He's gone to the milk bar.
He's gone to the milk bar.
So, Di, that was quite intense. I must say, I was probably
It was, but it's over now.
as nervous, though, as... Well, I think I possibly was more nervous than you.
Oh, I don't know. I wouldn't say that. Scott has done brilliant. And he's been nice with him, and that means a lot.
Good boy, Freddie. I must admit, I've absolutely loved it today. Di's an incredible woman. We're in a nice, warm shed, performing an incredible surgery on a beautiful animal with a great result. And my relief, I think, was just as much as Di's. Hopefully that's his expressing his happiness at our work. Not bad, City Slicker. Good job.
With his first horse surgery behind him, Scott has arrived back at the practice to help out with little Toots' surgery.
Hey, Joe.
Hiya.
What's happening?
This is Toots I chatted to you about. So we've just done the X-ray. Bladder's full of stones.
Ooh,
Yeah,
no.
poor little man.
So just like 1 or 2 stones?
No, literally looks like sort of 30 in there, I think. So the more help, the better to get them all out, I think.
No worries. OK, well, I'll go and defarm and I'll be back in a sec. See you in a bit.
Lovely.
Nurses Lauren and Sherry are helping Joe prepare 9-year-old Toots for his operation.
So the aim really is to remove all stones or as many of them as we can. So what we're hoping to do is just go in, assess the bladder, remove the stone and flush out any of the smaller ones. I think we're ready to start.
Right, finally, I'm in a uniform that I feel a bit more regular in. This is my normal job.
It's going to be quite nice having an assistant, I think.
All right, let's get those nasty stones out, shall we?
Expecting the bladder wall to be quite thickened as well if he's had the stones in there for a little while. You can just see his bladder there.
Yep.
I can feel a stone just under my finger, actually.
No
just
way.
there.
Can I have a feel? Oh, wow. It is like a bag of gravel.
Yeah.
Yeah.
Poor little boy.
Yeah.
So there's the bladder.
It's very angry and inflamed, isn't it?
Yeah.
It is certainly a very irritated bladder, and it's because of the stones within. And how big were these stones looking?
They weren't looking very big, but there's quite a lot of them. So I think if we start with a small spoon, and then if we need to, we might need to get the bigger one in just to see if there's any bigger bits in.
Normally, when you remove a bladder stone, it's a nice, round, smooth rock, really. It's like a pebble.
There we are.
Wow. These ones, however, are very harsh, they're very sharp, and they're deeply embedded into Toots' bladder wall. Nasty little suckers, aren't they?
It feels like there's quite a few more in there as well, I think.
The more we scoop, the more we find. It's incredible. They just keep coming, and they're really angry, sharp-looking stones that are getting stuck into the bladder wall and really causing irritation to poor Toots.
And I think it feels like there's quite a few more in there.
Poor boy, he must have been in some discomfort with those.
You can see why it's inflamed all the bladder wall so much, can't you?
As a boy, passing those types of nasty stones, ouch. Oh, there's a whopper.
We were expecting quite a few stones, but there's more here even than I thought there might be. They seem to be never ending. 27, and I think that's 28.
28?
Yeah, goodness
Wow.
me. And some of these look like sort of, 5 or 6 joined together to make a big one.
That's a lot of bladder stones.
And still a few more in there, I think.
All right, so do you feel confident then that that's the last one?
Yeah, I think that's it. 2 more from that last flush, so that brings us up to 30.
Look how chuffed you are getting that right on the X-ray. Very impressive.
We removed all of the larger stones. I think it's the biggest haul I've had from a bladder so far.
All right, let's close this boy up.
Lovely job. It's going to be a bit of a recovery because there's obviously so much swelling and inflammation on the bladder wall. It's going to take a little while for that to settle down, but he should make a full recovery. Thank you very much for your help.
Oh, more than happy to do so. Being involved in this surgery, you might think, oh, wow, it's opening up a bladder of a dog and pulling out stones. Well, for me, it was a relief. It was great to be in 4 walls at a roof, not covered in rain, not covered in poo, and doing something that I know how to do really well. What do you think they've got for me next?
5:15, it could be anything. So I'm sure they'll have something in store. As long as you've got your wellies on, I'm sure it'll be covered.
It's Scott's last day in Wales, and the team at the practice have one final job for the visiting vet.
I just had a phone call from one of the young farm vets, Vicky, when she needs my help. I have no idea what kind of animal I'm dealing with, but I'm looking forward to seeing what she's got in store. Right, Vicky, the cavalry's here.
Oh, it's got muscles.
Right.
Hope you've had your Weetabix this morning.
Okay, why?
Oh, we've got quite a big ram to deal with today.
Oh, a ram?
Yeah.
Really?
This is Codley's Animal Rescue, where owner Val takes in unwanted animals.
Hi there, Val. I'm
Hi.
Scott.
Hi, Scott.
How you doing?
Nice to meet you.
Nice to meet you as well.
We take in animals that have been abused or neglected, and this is their forever home. People contact us when they know that there's an animal in need, because they know we'll go and get it. We just love what we do.
But it's a ram called Gordon that needs immediate attention.
When he came, he was just called Rammy. I didn't like the name, so I put a thing out on my Facebook page and asked for ideas, and somebody suggested Gordon. Gordon Rammy it was.
6 months ago, Gordon was rescued from an abattoir. To avoid injuring himself and his fellow animals, the feisty ram's large horns were removed under anaesthetic.
I thought you might like to see these are what came off him.
Wow. That's impressive.
They weigh 7 pounds each.
Gordon has been thriving in his new home, but recently rescuer Val has noticed a problem.
I went out to the field today to check on them, and I saw he was bleeding from his horn. He obviously needs help from you guys.
So how are we going to go about catching this chap?
I think that's your job, really. Into this corner, just muscles.
Right. Right, wow, so it's very technical.
Just muscles, that's all we need today.
Okay.
I'm going to enjoy watching this, because I did it earlier. Gordon is very feisty. When I was treating him earlier, it was like buckaroo around the pen.
Okay, well, should we just get stuck into or just vault this?
I would open the gate.
Right.
It's much easier.
Sure, okay. Fair enough.
Okay.
There we go. There we go, that was easier, yes.
I should have not said anything and just let him fall over, but I thought it was common sense. Why climb it when you can walk through it?
Hello, Gordon. Keep that infamous temper in check.
Good luck, guys. You're going to need it.
Okay. Come on, mate. Whoa. Oh, my goodness. Yeah. Come on, champ. This way. Come on. Come on. Good boy. Okay, good boy. Oh, you.
Who's winning here?
Well, it's sort of a tie at the moment. Wow, that looks disgusting. Yeah. I'm really close to his head. You can see there's a lot of discharge, there's maggots present. Alongside that, it really smells.
Fortunately, Val's found this quite soon, so it hasn't done too much damage.
It's all right, mate. Good lad. Good boy.
All right, I think we're give us a bit of a clean-up and then give him some pain relief and some antibiotics.
That
Hey, man,
sounds
make you
fair.
feel a bit better.
I was very, very concerned and very, very anxious whilst he was being treated.
Oh, no. No.
I'd be devastated if I lost him, because he does, literally. He means the world to me.
What do you think of those fine ingredients, Gordon Rammy? Is it going to sort you out? I reckon. Here we go. All right, be brave, mate.
And we want to try and dry up all the infection that's there, get that growth to shrink back and then try and seal off those holes so nothing can go back down into there.
It's all right, mate. Good boy, brave boy.
Scott really does have a great affinity with animals, and I've never seen that with Gordon, especially with somebody he hasn't met before.
This is just some antibiotic spray to help with any infection.
Looks great.
Yeah.
So antibiotic injection and then pain relief.
Yeah.
Brave boy.
There we are.
How'd you go? Well done.
Come on.
Good
Should
boy.
make him feel a lot better. I was a bit dubious when I rang Scott as to whether his muscle factor would be advantageous for me.
Hopefully in about an hour or two, mate, you're going to feel much better.
But I think his allure to the animals was probably more than the muscles, to be honest. And I think his sweet whisperings in Gordon's ear helped.
Hopefully those drugs will start kicking in, you'll feel better. Back to your feisty self, eh?
Val will have to keep a close eye on Gordon's wounds.
Good boy, Gordo. Good lad.
And they should heal in a couple of weeks.
Oh, he was a perfect gentleman in the end, wasn't he? Just like Gordon Ramsay, obsessed with food.
And Scott's not the only one who's up early this morning. Joyce is on her way to the practice after a long night missing her beloved dog.
I'm back to pick Toots up after his operation yesterday. So, big smile on the face today.
And it seems little Toots is just as excited.
Feeling better. Oh, good boy. Should we go and see your mum? Hey, who's this then? Ah, who's this? Oh, pleased to see you, I think. Little man. Oh, good boy.
You don't know how happy I am. No, it's a really good feeling. Can't stop smiling now that I've got him back.
You heavy little monkey. I know, I think he's put on weight. He's done so well. He's really bright this morning. He's really happy. Doesn't seem uncomfortable at all, so...
You're not going to talk to me, are you?
No.
It's all over and done with. Just want to get him home now and cuddles on the sofa tonight, and that's it. Come on, there's a good boy. Going home now, aren't you? Yes, you are. Come on, dear sweetheart. Come on.
And it's also time for Scott to hand in his wellies and head home. His time in rural Wales has been an eye-opening experience for a city vet dreaming of a life in the country one day.
He's got a lovely temperament. Yeah, I can tell.
I've absolutely loved every minute of my time here in rural Wales.
That's an experience I haven't had in 17 years.
Can't make a farm vet of you yet, Scott.
The farm vets and nurses have just been so inspiring to work with. The animals, impressive and beautiful.
I think I possibly was more nervous than you.
Oh, I don't know. I wouldn't say that.
Hello.
But I think it's been the wonderfully warm and resilient Welsh people and the fantastically beautiful landscapes that have captured my heart and made me think that I could make a go of it as a farm animal vet. But for now, I've got to get back to my family, back to the practices in Richmond, but I know I'll definitely be back.
It's early morning, and Scott is on his way to Berkshire for an emergency call-out.
This time it's a 9-week-old puppy. I've never heard Jill so worried before, so I need to get there straight away just to see what's going on.
She was the last puppy left in the litter, and obviously nobody wanted her because of how she is. Oh, she's such a good girl.
Jill's incredible. I mean, she dedicates her entire life to looking after border collies that have come from desperate situations, and they come to her house and the heaven that she offers.
Good girl.
She's an absolute saint as far as border collies are concerned.
You are a good puppy.
Today, it's Jill's latest arrival, Malala, that she's so concerned about.
I've rescued her from a farm. She's obviously a very poorly puppy. Hey, keep still.
The little border collie is badly malnourished and is also struggling to control her head and body.
Hi, Scott.
Oh, my goodness. This is a little one for you, isn't it? Hello, baby. Oh, my goodness. You're so cute. Oh, dear. Wow, she's very floppy, isn't she?
I think she's lucky she's alive, actually.
You decided to rescue her, haven't you?
Yeah. I just want to shower her with love, really, because she's such a pathetic little thing. And she would definitely have died where she was. Bless her heart. So I'm hoping that Scott will be able to do something for her. It's okay, baby girl. It's okay.
As soon as he examines the little pup, Scott immediately suspects another serious issue.
What seems to be the problem here is that you look blind to me.
Yeah, but she doesn't matter if she's blind.
It doesn't matter. My first impressions of this puppy are not good.
Come on, darling.
Honey.
Hey, good girl.
Oh, my goodness. She's just the definition of neglect. She's very thin, but the most concerning thing is she seems to have this very strange sort of head tilting that's going like this.
Hey, good girl.
She definitely has an abnormal gait. The way she's walking is very stumbly and she's unable to keep her balance.
Come on. Oopsie.
Oh dear, did I leave my box
Come
in the
here.
way? Sorry, baby. She simply cannot control her own body movements. She's not got just a few issues. There's a lot of issues here. This hip is feeling really quite weird. It's very stiff, swollen joints.
I think she's twisted. Oh, come on. It's all right, sweetheart.
Oh, baby. Oh, dear.
The little pup's swollen joints are obviously painful, so Scott will now take her back to the practice so she can be sedated and given a more thorough examination.
This puppy is in such a terrible state. I am really, really worried about her future. Honey, come on. It's all right. You're safe now. Come on, you're safe now.
In St Margaret's, in southwest London, Border Terrier Wellham looks and acts like a normal, healthy 18-week-old pup.
Oh, good catch.
Especially during playtime with his dad Barder and owners Martin and Helen.
You're doing your biggest brave dog growl, hey?
But in Wellham's case, appearances can be deceptive.
So Wellham's got an issue with his man parts. I'm not quite sure if this is the right terminology as well, but apparently he's got a micro penis.
They do say dogs take after their owners.
They do, yeah, quite. So despite the fact he's quite a big lad with big paws, he's not going to grow into his manhood.
We aren't going to be the couple with the micro penis dog. We can't take them out anywhere ever again. Wellham won't be able to hold his head up in St Margaret's.
He's going to get bullied at puppy school.
He will get bullied at puppy school.
So easy.
The condition can be serious. If the penis doesn't grow, the empty space around it can be prone to ongoing infection.
He's a big, roughy-tufty puppy who thinks he's a Rottweiler at least, and yet he's got a micro penis. It's awkward, isn't it? Sit.
But little Wellham has another more urgent problem. He's almost 6 months old, but still has one undescended testicle.
Today we're going to go and see Scott to talk about the next steps. So after the initial consultation at 8 weeks, we knew he needed to go back to kind of explore what was going to happen.
You're not having it, are you?
If there's no change in his condition, Wellham will need invasive surgery.
I can't say I'm massively looking forward to leaving him at the vet's whilst he goes under for an operation.
Yeah, the idea of putting him under the knife isn't very appealing. Anything to do with an anaesthetic and putting him through a procedure like that, but equally something as intimate or personal as that. I don't want to change who Wellham is.
Good boys.
Hey, come on then. What's this? This is the clinic. Let's go and see the girls, shall we? Hey.
Scott's arrived back at his Richmond practice with little Border Collie Malala.
Hi. This is Malala. Oh, short. Lala for short.
Lala.
Yes.
Hi, Lala.
Say
You're
hi.
wiggly.
They're met by concerned nurses Gemma and Sam.
Are you wiggly? Oh, what's wrong
She's
with
got a
her?
head tilt.
She's got a little head tilt, and she's also got these very, very lumpy joints, which we're going to look into today. But the saddest thing is that she is actually blind.
Oh no, Lola. Oh, she tried to come to me. Oh, hi. Hello.
Seeing the girls lavish Malala with all their love and attention, it's just so beautifully heartwarming to see. Lala. Lala.
She wants Auntie Gemma, not Uncle Scott.
Come on then, unhand. Come back to Scott. Come on, beautiful. Okay.
Oh.
Come on then, Sam. Let's get cracking. What I need to do now is do a barrage of tests to work out what the problems are caused by and if there's anything I can do to help this little puppy and help to improve her future.
Oh, good girl. It's all right, it's all right.
No.
Good girl.
Given little Lala a sedation in order to take some x-rays, but also to be able to look properly into her eyes, do everything I need to do, it's best that she's a little bit sleepier than she is right now. Come on. Let's have a look at some of those joints, shall we?
First up, Scott is x-raying Malala's legs.
X-ray. Right, Sam, so you can see how white some of these bones are here, and yet how almost translucent they are in other places. So this dog hasn't had enough calcium. That very much suggests the old school disease of rickets. Rickets is caused by malnutrition, and for Malala to have such a severe case at such a young age, you can just imagine what sort of appalling diet this poor puppy's had. Her bones can easily break and literally tiny little microfractures develop just so easily because they're so brittle.
It's just so sad that it could have been prevented.
Yeah.
Rickets is caused by a lack of vitamin D, but fortunately with proper nutrition, the condition can be cured. But the little dog's vision loss and severe imbalance are far more complicated.
This case is really challenging on so many levels. Malala's got so many different symptoms that could be caused by so many different things, and also her early part of her life we don't know anything about. What I should normally see in the back of this eye is a beautiful carpet of kind of greens and yellows, but what I can see here is just shades of grey, and I can see them in both eyes.
With a growing suspicion that Malala's blindness and imbalance might be connected, Scott is hoping blood tests will provide some answers.
So I'm taking some blood to test Malala for a couple of things. First of all, there's a few parasites that can affect the nervous system of a young dog and also cause them to be blind. I'm particularly concerned about Neospora. It's a certain type of parasite, a protozoan, that can be present in cattle, and then dogs can get it, and it's very bad news, particularly in puppies.
Should we get some food? What's in here?
The results of the blood tests will take several days, but Malala's rickets treatment can begin straight away with some nutritious food.
The good news is that with good nutrition, we should see this puppy much more comfortable.
Don't gulp it down too quickly. Give yourself bellyache.
Scott is also planning to take Malala to an eye specialist to see if anything can be done to restore her sight.
She has literally captured the hearts of every single person at the practices. She means so much to us now, and we're really hoping that this little dog is going to pull through and live a happy, healthy life.
Oh, excuse you. That's what happens when you eat your food too fast, isn't it?
Martin has arrived at Scott St Margaret's clinic with his Border Terrier's father and son, Barda and Wellham.
Hey, Scott. How you doing?
Hey, Martin. Good to see you, mate. How are you?
Yeah, good, thanks.
Hello,
Good, you?
boys. Hello. Are you okay? Hello, monkey. You're in trouble, aren't you?
All right, coming in. Let's have a chat.
Alrighty. Come on, Barda, let's go.
Come on, boys.
This consultation is a follow-up from when I was 8 weeks and brought him in to meet Scott for his first round jabs. We knew there were some potential issues with his manhood, shall we say.
Oh, I love a Border Terrier puppy. Yes, I do. How's he been getting on, Martin?
It's been great. He's absolutely brilliant, yeah. Yeah, he's settled in really nicely. Barda's been brilliant with him. We're just going through the teething stages at the moment.
How is our little chap going?
Nothing's come up, so to speak.
Wellham has a medical condition known as a micropenis.
Well, what we're going to do is, if I can just get him leant this way,
Sure.
and then I can just have a look.
All jokes aside, the problem can be quite serious.
It is an issue where they've got a prepuce, which is the sac that the penis sits in, and because it's not being filled properly, it does then expose the dog to infection and build up of discharge.
Scott is hopeful that with time, as Wellham approaches maturity, his penis will have grown to a normal size.
It doesn't seem to be affecting Wellham at all. He's still a boisterous, fun-loving puppy.
Now to find out if there's any improvement in the young dog's testicles.
So what I'm going to do is we'll spin him round, and I just want to have a little feel of his testicles now.
Okay.
Now, the problem we encountered before was that he only had one testicle.
Yep.
His right testicle I can feel, but no left testicle.
There's none, okay.
No.
And is that because it's not developed, or is it stuck up inside him somewhere?
Unfortunately, it will mean that it is inside his abdomen.
Okay.
Poor little Wellham has a condition called cryptorchidism, which is basically where one or both of the testicles haven't descended properly into his scrotum, which is the bag on the outside. The testicle tucked up in the abdomen overheats. That overheating can lead to mutation, and mutation is the basis of cancer.
Scott is recommending that to safeguard against Wellham passing on the genetic condition, both testicles will be removed.
He's not really breeding stock.
All right, little man.
Exactly.
All right.
Hey.
Well, you just have to be the fun party guy, won't you?
Yeah, you'll have to be the good-looking guy. Hey, what do you think?
Wellham's surgery will be scheduled a few weeks from now, when he turns 6 months old.
Come on then. Let's go and see that eye doctor. Hey? Yeah, let's go and see the eye doctor. Sounds scary, but it won't be. She's very nice.
Next day, Scott has arrived at the Royal Veterinary Hospital with Malala, hoping for a miracle for the little rescue pup. He's meeting ophthalmologist Marian Matas-Riera.
Hello.
How are you?
Good, thank
and you. Very well. More importantly, this is Malala.
Hello, Malala. Shall we have a look at you, my love, see what we can do for you? So do you want to come to the concert room?
Yes, please.
Yeah,
Lovely.
Let's go.
Gorgeous. It might be unrealistic, but I'm just hoping that Marion will find something that we can do to help treat Malala's blindness.
So what we'll do now is we're gonna dilate her pupils so we can have a good look at the back of her eye. Hey, puppet. Good girlie.
Drops. This puppy is so gorgeous. She's had such a tough start in life, and now I just want the best for her, and hopefully that means vision.
So I know I look like Darth Vader now with this, but the aim to use this instrument is so it allows me to look at the retina, so at the back of her eye. Okay, Lala. You gonna let me do this? Yes, good girl.
I know. Good girl. Darth Vader is scary. Yeah.
This is very important, my love. This is very, very important, puppet.
Good girl.
Good girlie, my love. Good girl.
Good
there we go. Good
well
girl.
Done, baby.
Okay, so her retinas are not good. Her retinas are really severely damaged.
The prognosis is not looking good for Malala.
Her retina is really unhealthy. There's no blood vessels at all, and that is quite shiny, which tells me that is really abnormal. So it's really has degenerated to the point that is nearly atrophied. And that's not good news because it's not a tissue that we can make it regenerate. Once it goes, it goes.
Oh dear. Oh dear. That's no good, is it? Hey, that's no good. The changes present in her eye are something that you don't see very often in puppies, and it does mean that Malala will never regain her vision.
Oh, wow.
Good girl. Where's Scotty?
done.
Where's Scotty? Come here.
Despite her blindness, Malala is young enough to be taught to follow voices and the sounds of footsteps to help her get around safely.
Well done. Oh, you're so clever.
Finding exactly what's caused the puppy's blindness and her balance problems is the next big challenge. Scott is pinning his hopes on the blood test results for some answers.
Oh, what a good puppy.
Oh, fantastic.
Sadly, there's no technology here at the RVC that can help little Malala to regain her vision. But on the positive side, I've heard about another special puppy that the RVC does have the technology to help. She's coming in for what's really cutting-edge surgery, and I know everyone here is really excited about it, and I can't wait to hear how it goes.
North of London, young puppy Pippa and her family are getting ready to head off for their appointment at the Royal Veterinary College.
The children adore her, and she definitely makes the house even happier because you're greeted with this bouncy little puppy and they absolutely love it. They really do. Good girl, Pips. Good girl.
Little Pippa has a serious medical condition, and playtime isn't as much fun as it should be.
Oh, poor girl. Look how wet you are. You need another bath. She leaks urine. One of her tubes isn't going into her bladder and it's coming straight out of the urethra, which means the urine just leaks out, which is very unpleasant for her and for us. Let's give you a wipe over, get all that smelly wee off you. Smelly wee-wee. You know, new puppies, you want to cuddle them and love them, and at the minute we just, especially the children, I feel like they can't do that properly at the minute. Come on, baby.
Pippa has already undergone extensive testing at the Royal Veterinary College, and she's booked in today for corrective surgery.
Come on, Pips.
So the procedure that the RVC specialists are going to perform on Pippa is called a laser ablation. And what's super cool is that most dogs will become continent immediately after the surgery. It's awesome.
Hi, Miles. Hello.
How are you?
Nice
to see you.
It's time for the young family to hand Pippa over for her surgery.
I will not be able to stop thinking about her. It's like we've got a fourth baby. Give her cuddles. Bye, Pips. Love you, baby. See you soon. She's going for a little operation, so we can't wait for her to come home after. Good girl. Don't get upset. She'll be fine. She'll feel better.
Hey, buddy. You all right in there? Let's see what Uncle Scott says about your little chin.
At St Margaret's, one of Scott's nurses, Emma, is bringing in a very special patient to see Scott.
Hi, guys.
Hey, hello, Ed.
Hello. Hey. Unfortunately, not a social visit, I'm afraid, as much as I wish that it was.
8-year-old Ed is Emma's much-loved rescue cat. She's worried about a nasty lump on his chin.
It's always a little bit nerve-wracking when any of my team bring their animal in, but also I think it's quite touching because they trust me, they want me to look at their animals, and they want me to tell them that everything's going to be okay.
We noticed it a couple of months ago, and it seems to get bigger, and then a few weeks ago it seemed to burst, and now it's refilled again. It's obviously just annoying him. Or...
Yeah, you're not happy about it either, are you? Yeah, I don't like the look of that too much. Let's bring him into the consult room and we'll have a closer look. Hey,
come on in, buddy.
Come on then, champ. Come on, big guy.
Big man. Where's he, mum's boy? Hey, yes, he is. It's very, very odd being on the other side of the table, actually bringing my animal in for a checkup, not just a social visit. So the nerves are high today, I won't lie.
You know, it looks very cystic, but we also have to think that there is a possibility that it can be one of the more common types of skin tumours that affect people, which is melanoma.
Yeah.
And is he a keen sun worshipper?
Loves to lie in the sun. Loves it.
Clearly that lump is not normal. It looks very angry. It just looks very active. So I do think that we should probably try and get rid of it. Take it out with surgery.
Definitely.
Remove it completely. Let mum feel happier about life.
Yeah.
Then we just wait and see what the results show.
Yeah. It is super important to us. You know, he's a member of the family. We don't have children of our own, and he is our child. You know, he's there when you wake up in the morning. He's there when you go to bed. He's there when you're sleeping. He's just there all the time. So, yeah, he means everything to us.
He's such a good boy. Hey?
Honestly, you two need to get a room.
Got a kennel, thank you very much.
You do. Hey, you ready for the big op today, big guy?
At St Margaret's, it's the day head nurse Emma's cat Ed is having the nasty lump on his chin removed.
Thankfully, Ed's procedure should be quite straightforward, but at the Royal Veterinary College, Pippa's surgery is in a whole other stratosphere. They're going to be using high-tech laser surgery, so good luck to Pippa.
You all smelly. Should we get you fixed up today? Good girl.
At Scott's referral hospital, the Royal Veterinary College, Pippa is now being prepped for her operation.
Okay, little wriggle bum. Let's see what happens.
You're going to be super brave, aren't you?
The little dog is constantly leaking urine because of a fault with one of the tubes leading from her bladder.
Good girl.
Yay!
Today, Pippa is not only getting VIP attention from the nurses, she'll also be undergoing state-of-the-art laser surgery, performed at only a handful of hospitals in the world.
The benefit of the laser ablation procedure is that it's minimally invasive and associated with short recovery times, so that makes the whole experience a lot less stressful for Pippa.
A microscopic camera has been inserted up into Pippa's body to show the team exactly where the problem is.
So what we're looking for is the opening of Pippa's left ureter, which is the tube coming down from the kidney into her bladder. And in Pippa's case, that opening is in the wrong place, and that's what we're trying to fix.
My belief is that this is the opening into the ectopic ureter, and that is the urethra up there. And you can see urine coming out.
Professor Hattie Syme is leading the surgical team.
Okay, we're on standby. Do you want the energy up?
I think we can go with 1 and maybe 10 to start off with, please.
So this is the exciting part of the procedure. This is where we can see on screen the laser beam that's cutting away the excess tissue that's causing Pippa's ureteral opening to be in the wrong place.
It's just a bit messy at the moment because we've got a bit of a blood clot, but that's not unexpected because what we're doing is cutting tissue. So maybe come back and have a look from a distance and see where it is relative to the urethra.
If the laser has done its job, it will mean no more leaking urine for Pippa.
Yep. Yep.
A special dye is now being used to test the repair.
We can make sure that the ureter is entering in the right place. We can stop there. It's clearly in the ureter and there's clearly no leakage, so we're very happy.
You smell nice.
With the surgery complete, it's now time to wake Pippa up.
You can wake up now. Come on, baby girl.
She'll be closely monitored overnight.
So we're just going to go and pop her into the incubator because she's a little bit chilly.
A big test will be whether she stays dry.
Good girl, Pips.
Okay, little scratch. Ready?
Good boy.
Good. So, ready for a bit of anaesthetic there, champ?
At St Margaret's, Scott is about to start removing a large lump from Nurse Emma's beloved cat, Ed.
I don't think I've ever had you this quiet, Ems. It's quite nice. Mummy's nervous, I can tell.
Mummy is nervous. Mummy doesn't do nervous.
All right, baby boy. He's a good boy. He is.
You're a good boy. Mum's here.
Good lad. Yeah, it's okay. Look at Uncle Scotty.
It's definitely feeling a lot more real now that Ed's anaesthetised and on the table, and we're about to take him into theatre. It's actually a big deal now.
Let's have a little look at this chin, shall we?
With Emma present for the operation, Scott's feeling even more pressure than usual.
I would say it's quite tricky to have the owner being present and actually helping you with the procedure because normally you act in a certain way with the patient and you need to have that emotional separation. Wow, actually, this thing goes down quite deep. Now that Ed's under anaesthetic, I can feel that this lump actually is much bigger than I first thought. It's about twice the size, really. So it's actually like a pea that's under his skin. You know the rule for trying to remove what is potentially a malignant tumour?
Bigger is better.
And the average margin is about 3 centimetres, which clearly I'm not going to be able to do. Otherwise, I'd have to take half of his jaw off. So it might mean, worst case scenario, if it does come back as something that we're concerned about, we may have to go back in and do further surgery.
Whatever you think is best, I trust you 110%, so
Okay. All right.
whatever you think is best.
All right.
I think it definitely makes me a bit more concerned knowing that that lump is a lot bigger than what I thought was just a superficial cyst. So yeah, I'm anxious to get it off to the lab and see what they say.
So how's the patient going, Ems?
Patient's good. Patient's keeping Mum happy for the time being.
I was actually talking about Mum. You all right?
Yeah.
I know Emma very well, and normally she's very calm and very assured under pressure. Definitely more nerves today. You can just see it in her face and her eyes and the way that she is speaking a little bit less. I can tell that my Em's a little nervous. It breaks down very, very easily. Attach right to his chin. Okay, so I think I've got it all out there. Very satisfied that it is now out of your cat. Removing this lump, it really doesn't look very nice at all. It breaks down. It's what we call friable, which is very sort of delicate, and it's very flesh-filled. So I don't know what it is just by looking at it. I don't like the look of it, and I'm really glad that it's out.
It's been a short but tense surgery, and Scott is not the only one who is relieved.
I'm glad we didn't wait any longer to do it. So, yeah, feeling better now it's gone.
So, Ems, this black spot on his chin, how important is it to you and to him?
I mean, it's his little beauty spot, so if we can save it. So Ed has this gorgeous little beauty spot on the base of his chin, which we absolutely adore. And it's part of his personality, I think. So if we can save the spot, that would be great. But if he loses a spot and it means that he's safe and healthy and that we've got rid of something that might be nasty, then that'll be okay.
Only perfection will do is basically what you're saying.
Yes, that's exactly what I'm saying.
It's smaller, but it is still there. And once the sutures come out, it'll look perfect. So,
thank you very much.
my pleasure.
It's like Cindy Crawford without her spot. Yeah. Couldn't have it, you see.
It shouldn't be allowed.
No, this is where I'm very happy that you are a perfectionist.
I don't know if he's as hot as Cindy Crawford. You're nice, but come on, you're not that nice.
Emma did a great job today. She really kept a level head, and although she was very worried about Ed and how he was going under anaesthetic, she kept it all inside. She monitored the anaesthetic beautifully and got the result she was looking for, which is her boy woke up perfectly fine.
Come on then, little man. Come on then, little man. Oh, I know.
But Emma won't be able to relax until she gets the results of the tests on the lump.
You rest up again, sweetheart. You rest up, buddy. All right, little man. Back in a sec.
At Scott's referral hospital, the Royal Veterinary College, an excited Pippa is ready to go home. And little Harry and Mum Vicky can't wait.
Are you nervous?
A little bit.
She'll be fine, don't worry. She'll be fine. She'll be all better. All her problem will be sorted, okay? I wonder where she is.
We're going to pick Pippa up today and I'm really excited to see her again. When we get her and go home, I want to just play with her and be happy that she's back.
Pippa, who's that?
Hello.
There you go.
Hello. Hello, baby.
Hello. I'm excited to see you.
Hello. We've missed you so much. You've been a good girl. Yeah.
So Pippa's been doing really well since her procedure. We haven't noticed any dribbling in her kennel. Her bedding's been nice and dry, and she seems really comfortable. So really good signs. Yeah, really pleased with how everything went.
It's great. Thank you so much.
Yeah, you're welcome. Not at all. It's a pleasure.
Oh, come on. Thank you so much. I'm so pleased the procedure's all done and we can enjoy her and hopefully no more problems. We can enjoy our little dog. Oh, good girl.
At Scott's Richmond practice, rescue pup Malala's blood test results are now in.
Toxoplasma. Negative. Excellent. Very good.
Scott is hoping to find out why the young dog is blind and struggling with her balance. He suspects a dangerous parasite called Neospora could be the reason.
Neospora, more than 1,600. I'm totally shocked. The results are in and the Neospora level is just through the roof. So she has definitely been exposed to this disease.
Neospora is a potentially fatal parasite that attacks an animal's brain and spinal cord, gradually shutting down their body.
Gutting. Most of the time, puppies or dogs that get Neospora end up dying from it. It's a nasty condition. It causes all sorts of things, from ascending paralysis, where they just get weaker and weaker, they can't eat, they have liver problems, they have breathing problems, they have muscular spasms. It's a horrendous condition.
Oh, good girl. Is that nice?
The little pup is waiting upstairs with Nurse Sam and receptionist Kirsty.
Hi, guys.
Scott.
Hey, yeah.
Teaching her a few tricks.
Oh, yeah?
She's doing very
Good.
well, very well.
Good. Well, I'm sorry to be the deliverer of bad news, but unfortunately I've just got the blood results back and she's got Neospora, which is pretty bad. So it basically means that she does have neosporosis, the clinical disease, and unfortunately at any point she could deteriorate badly. And we're talking paralysis, we're talking unable to walk and swallow, and liver problems, breathing problems. It's hideous.
Malala will be started on a course of antibiotics immediately to hopefully wipe out the parasite. She now has a tough battle ahead of her as her body tries to fight the disease.
I'm so sad. Just seems to be one thing after another that we keep finding.
It's not fair, is it?
I'm willing with every part of my being that this beautiful little dog gets through okay. Such a good girl. Hey. Yeah, that nasty Neospora isn't gonna get you, is it? No. No. Hey, you're so nice. Hey.
Morning, team.
Hey, Ems. Hello, little Ed.
In St Margaret's, it's been a week since Nurse Emma's cat, Ed, had a nasty tumour removed from his chin. And today, the results are in.
We're back again.
Yeah, he has been a little bit of an headache, hasn't he, of late? He has.
How long did it take you to come up with that one?
Oh, a good couple of years.
I don't quite know how to put into words what I feel about Scott's puns and his bad dad jokes. It's just Scott Miller all over.
Despite her brave front, it's been an anxious time for Emma.
Hate waiting for results. It's literally felt like this has been the longest wait.
All right, then. Let's get you into the consult room and we'll tell Mummy some news.
Yes, please.
Emma has been incredibly worried about the result that I'm going to be giving her today regarding Ed's tumour. It was a very angry, very fast-growing tumour, and Emma knows that they are all the indicators of a potentially aggressive tumour, something like cancer. I know how much you've been worrying about this result. Yeah.
Go on.
But the news is good.
Is it?
Yes.
What is it?
It's an apocrine cystic papillary tumour, which isn't a very common tumour at all. In fact, the pathologist had barely ever seen it. But the good news is that it is benign, and hopefully by removing it, it will never come back.
Fantastic. Yeah. Oh, isn't that good news, bud? Hey?
I am so over the moon that we have got the results for a benign tumour. That is the best news we could have hoped for. So I'm just enjoying the news that we've got the all clear.
Oh, I'm so pleased. Are we pleased?
Hey, you pleased?
Are we pleased?
You happy?
Say thanks, Uncle Scotty.
You don't have to worry. No.
Thanks.
He is such a beautiful cat, and I would say that he's head and shoulders above the rest.
Oh no, it's just getting awkward now, isn't it, mate?
Oh, I'm just gonna
Take your cat away.
My cat.
Yeah. Save him from the bad jokes.
Bye now.
Bye, Ed.
Bye.
Bye. I think he liked it. You gonna be a good patient today?
Yeah. You don't be nervous. This is going to sound really wrong, but I'm looking forward to seeing the size of this penis.
Wow, that's something you've never uttered to me before.
At the St Margaret's Clinic, it's time for Wellham's surgery, with Nurse Gemma assisting.
There we go.
Yeah. That's not too bad, is it? Brave boy.
6-month-old Wellham is having both his testicles removed, But first, Scott wants to see if there's any good news to report on Wellham's micropenis condition.
Now that Wellham's well and truly under anaesthetic and he's nice and asleep, we're going to just examine his equipment and just see how it's getting on. Well, it does seem like the young man is, well, he's certainly gained
Had a growth spurt.
Yes, he has gained some inches, which is great. I mean, he's really filling that sack now. I can leave you Willie alone, mate, which is good, isn't it? Yes, a man's prerogative is to have it left alone when he wants it left alone.
So it's just a normal penis, not
Yeah.
micro anymore.
Not
well
micro.
done, Wellham. Your dad will be very proud when we tell him.
But we'll have to prepare for removing this testicle and
Yeah.
then going for our fishing expedition.
Wellham also has a condition called cryptorchidism, where one testicle hasn't descended. So it's best that both testicles are removed.
All right, let's see if we can find this testicle, shall we? So we know it's on the right-hand side. That's it. So now I know where I need to go in. I need to go in right there.
Yeah.
It's almost certain that when a dog suffers with cryptorchidism, which is basically where both testicles aren't in the scrotum, that it is genetically inherited and it can be passed on from parent to offspring. So as far as Wellham's concerned, it's the right thing to do medically, but also ethically to ensure that he doesn't pass this on to future generations. So I'm ready to make my first incision. Right, so I've got it. He's a little fella, but perfectly formed, and thankfully it's come out relatively straightforward. So now his testicle, it's now going to be taken away. So that's just about the first one closed up, and then we can move on to the testicle that's in his little scrotum there. So you can see that's significantly bigger than the other side.
And there they are, in all their glory. Very beautiful.
Really?
No.
There you go, Wellham. Two nice little suture lines. No other boy will be able to tell the difference.
Hello.
Oh, sweetheart.
Well done. Oh, Bubba. Oh.
Yeah, you're all right. You're all right.
He's probably going to be feeling a bit groggy and not really 100% coming around from the anaesthetic because of all the medication. So he's coming around nicely, but yeah, he is being quite vocal. Oh, well, we're breaking our hearts.
Come on, you're okay. Come on.
After the successful operation, Wellham is making his feelings known.
You tell me all about it. Yeah.
Hi.
Hi, Gemma.
Hello.
Thought we'd bring Barda with us for the pickup.
Oh, you come to see your boy.
Quite like being back on your own, haven't you?
Oh, you had Mummy and Daddy to yourself. Well, have a seat. It's got to be up shortly.
Cool.
Okay, all right.
Upstairs, owners Martin and Helen are looking forward to being reunited with their little boy.
If he's in any discomfort or pain, then I think he'll like to see Helen anyway. He's quite a mummy's boy.
Hi, guys.
Hey, Scott.
Hey, here's your boy.
Hello.
Hello, little man. Hello. Oh,
Hello, mate.
boy.
Oh, look, both daddies are very excited to see you. Hey.
Hello, Papa. Yes, hello. I'm here. I know I've got you.
It's been quite a traumatic day for poor little Wellham.
Silly cone of shame's in the way, isn't it? I know. I got you. I got you. Hey, such a wuss when it comes to cuddles with me, aren't you?
Furry baby.
It's really lovely to see his whole family turn out to welcome him back into the fold with Helen and Martin and also Dad Bardo.
Here it is. Here it is. There you go.
Well, good news is, Dad, is that your boy could no longer be classed as having a micropenis.
It's great news.
In fact, he has, well, I suppose, a normopenis. But as far as the testicle is concerned, that's also good news. We removed the one that was internal, and although
quite a lot smaller than the other one, perfectly formed, no form of cancer or anything present. So that's really good news, isn't it, mate? Yes. And then, of course, he's then been castrated in the normal fashion. Yep. So I noticed that Dad is very closely looking at my handiwork. All right, guys. Take care.
See you.
Cheers, guys.
See you soon. Take care.
Cheers. Bye.
See you, Gemma.
Bye. Bye, boys. Come on, little man.
See ya.
He doesn't seem that bothered, does he?
No. No, he's totally fine.
It's just a cone of shame that's the problem.
I think he's still friends with you.
Next day, Scott has a special delivery to make.
There's my baby. Hey, come on. There's my baby. Come on, Dorothea.
It's a big day for little rescue dog Malala.
Hi, Jill.
Oh, hello,
I've got
Scott.
your baby.
Oh, Malala. Hello, darling. Hello.
The young pup is finally well enough to be reunited with her devoted carer, Jill.
You home? Yes, you're home.
It's always a wonderful feeling to come back and see Jill, but even better when you can reunite her with her baby, Malala. Malala's just such a beautiful little dog, and she's so plucky and tenacious that I'm sure that Jill missed her a lot.
You home?
Scott has been treating Malala for 6 weeks for a deadly parasite that has left her blind and attacks the brain and spinal cord.
Good girl.
For now, antibiotics seem to be keeping the problem at bay, but she's not out of the woods and needs to be closely monitored for the next few months.
What it means is that Malala is under a bit of a dark cloud. At any point when her immune system is weakened, all the clinical signs that we saw right at the start can happen again. She's on the right medication to protect her from getting any worse at the moment.
Yeah.
We need to make sure she's as healthy as possible, as stress-free as possible, to keep her immune system as strong, to keep fighting the disease, because if she can get to her first birthday party, her prognosis improves dramatically. Research has shown that if a puppy gets to their first birthday, there's a much better chance that they actually don't have the disease that will linger long term, which should mean that if she gets to that first birthday, life is good.
Well, I'm glad she came to me anyway, because she wouldn't be here now, probably.
Oh, without doubt, Jill. And I know that you're the one that will help her through this.
Oh, I will. I will. Won't we, Malala? We all will, because we love you, don't we? Yes, we do. She's got to get better for all of us. She's too much love for anything to happen to her. We'll just fight it together.
Should we show Mummy the dance? Hey? Should we show Mummy the dance?
Lala, ready? Lala. Lala, come. Oh, she's making me look like a fool. Lala, good. What are you not dancing? Malala and I decided at the clinic that we were going to perform a little dance routine to perform at her first birthday party. Lala, come. Come on. I worked out that she would follow the tap of my feet and then she would dance around me. Lala, spin. Oh, my goodness.
She says, why are you doing that?
I know. But as soon as we get to Jill's place, she leaves me hanging. I'm dancing around like a lunatic, but at least Jill found it funny.
No,
There we go.
That's it.
Here we go. Through the legs. Through the legs. Yay! Good girl.
There's room for improvement there, I think, but Malala did well.
That's a good girl. That's it.
Whenever we go and walk him, he just runs out of breath and he can't really breathe properly. So he starts making like this gurgling noise. Because it's really scary because it looks like he's going to pass out. So it's not nice to see or hear him like that.
With the condition getting worse, Annie is now seeking Scott's advice.
Come on, Cecil.
Hi, Annie.
Hi,
How are you? You okay?
Yes, yeah.
Yeah, what's been happening?
So, Cecil can't really breathe at the moment when I take him for short walks. So he gets really out of breath.
He sounds awful, doesn't he? Hey, mate, you sound like a broken washing machine, don't you? How long have you been running for?
Just like a couple of minutes, not long.
A couple of minutes and he looks like that?
Yeah, it gets really bad.
Oh, Annie,
Cecil.
that's not good. Buddy. What is all that noise, eh? You've only worn for 2 minutes. I've known cases of this where the dogs have literally just passed away immediately, so we should get into the practice straight
All right,
away.
then.
All right?
Yeah.
Come on, mate. My plan is that we need to take Cecil straight back to the practice because he is really struggling to breathe. He is a risk to himself breathing that badly, and I'm very concerned. So I do need to get him back to the practice and understand exactly why he's breathing this badly. There we go. Come on. Let me carry you. Uncle Scotty's got you. Come on. Mate, that breathing is shocking.
Do your hair. You have yellow ones in today.
A few miles away in Teddington, spoiled Shih Tzu Honey is being preened before she sees Scott.
Oh, she looks beautiful.
Owners Nikki and Barry are feeling anxious about their 10-year-old. Honey was born with a serious heart murmur and 6 years ago contracted inflammation of the brain. She's been on medication ever since.
She's a lovely girl, aren't you?
I always say Honey's like an inspiration. Whatever happens, she just goes in, gets on with it, and you watch it and you think, how can such a little creature have such a big heart?
Good girl.
But now, Nikki's noticed yet another problem with Honey.
Give us your paw. About 2 weeks ago, I'd noticed that there was something sticking out around her stomach, so I had a little feel of it, and she didn't seem to be in any pain. And then over the next few days, I monitored it, and it looked like it was getting bigger. I'm just hoping it's not cancer.
Come on, let's go. Where we go?
Let's go, baby. She definitely is a fighter, and I think Honey will be able to get through it.
This noise is just incredible.
At the Isleworth practice, Cecil's owner Annie is hoping Scott can find a solution to her 3-year-old French bulldog's chronic breathing problems.
Have you found at all that he has actually collapsed completely?
He'll collapse on all fours. He has been sick in the past. Like after running or during running, he'll just like get sick all over the grass.
Oh my goodness, mate. That's terrible. That's just not a way to live, is it? Eh? To make sure that I'm covering all the bases, I just need to check Cecil's heart and lungs. All right, so what I'm going to ask you to do, Annie, is just to try and close his mouth a little bit for me.
Okay.
Just to try and stem the noise, just while I have a listen to this chest. Good boy, yeah, you good boy. What am I doing? What am I doing? All right, okay. All right, right. So, there is some good news in that his heart and lungs both sound perfectly fine. So he is a nice, strong, healthy boy. Everything from the chest down, perfect. It's from the neck up that we've got real issues here. He's showing all the classic symptoms of a very common condition in French bulldogs called Boas syndrome.
Oh.
It is a syndrome where they have been bred to look a certain way, and unfortunately that's led to problems. The main problem is that they've got a really short nose and a sort of flat face, and as a result, all the soft tissues in the back of the throat have been shunted back, and also his nostrils, as you can see, are really very tiny. So the noise that you're hearing is actually the turbulence of the air flowing through the airways to go in and out. And you can tell there's quite a lot of turbulence going on. So he's not being very efficient in taking in the oxygen, taking in those breaths and then breathing out again. That's why he's out of breath. That's why he's panting. And that's why he collapses.
Okay.
Scott wants to operate as soon as possible on the beleaguered bulldog. Cecil will now rest up quietly before his surgery.
First of all, I need to perform a general anaesthetic on Cecil in order to be able to look down his throat. My guess is that he will have an elongated soft palate and that will need trimming, but I can definitely see that he has a tiny little nostril slits, and so Cecil needs a nose job. What do you think about that? Yeah, you're unimpressed, but you're going to have one anyway, I'm afraid. Hey, you'll still be beautiful. Yeah, but you'll be able to breathe and play with your mates. Doesn't that sound good? Yeah.
Over at Scott's and Margaret's practice, head vet nurse Emma is about to get a big surprise for her birthday.
Morning, Elle.
Hi, Emma.
Happy birthday.
This is for me?
This is your birthday treat.
Who's this?
This is George.
Hi, George. What are you doing hanging out on reception?
I see this beautiful ginger cat sat on Elle's lap, and he is gorgeous. I wonder if Elle's got me a really awesome birthday present, but I'm suspicious there's a little bit more to this story.
Earlier today, the ginger cat was dropped off at the clinic after his owners could no longer look after him.
Oh, that's a shame.
So he needs a forever home, but I need you to look over him.
All right, George, let's have a quick checkup.
I have totally lost my heart, George, and I'm hoping that Emma will too.
There we are. Oh, you're going to get weighed?
Oh, hello, little man. 3.5 kilos. That's... For a cat this sort of size, he really should be about 5 kilos or so, at least. I mean, you can feel all of his hip bones, you can feel his spine, you can see he's got no muscle on his back legs at all. Everyone will agree that he really just needs feeding up to start with.
We could do a bit of grooming as well.
Yeah.
Don't you think his fur's looking
I mean, his
a bit...
skin is all, like, you can easily see his skin through his fur, so his fur is not in a good condition at all. Oh, you poor little man.
Well, you're in good hands now.
Oh, let's have a little listen to your ticker. Listen to the purrs in this cat's chest. It's ridiculous. If you can hear a heartbeat out of this, you're a better nurse than me.
It's just purring.
I can't hear anything. I literally can't hear anything. We have been saying for a while that we should have a practice pet. Do you reckon Scott would let us keep him?
Well, you can only ask, Emma, can't you?
Because it's my birthday, I reckon I've got some power here.
Yes, definitely.
Hey, do you want to stay with us, George?
Oh my God, he's actually melting my heart a little bit. This is ridiculous.
Come on, let's go. Where are we going?
Let's go, baby. Where are we taking you?
The beautifully groomed Honey has now arrived at the Richmond practice for her consultation with Scott.
Let's go, baby.
Hi, guys.
Hi, Kirsty.
How are you?
Fine, thank you. How are you?
Honey. Did you want to have a seat?
Yeah.
I'll be with you in a minute.
Thanks.
Owners Nikki and Barry have recently noticed a large mass growing on the Shih Tzu's abdomen.
I can't even imagine what it'll be like if she's got something serious wrong with it. She's my absolute everything. She's just everything. Yeah, she's come so far with us. 10 years, she's been like my best friend. She's like my daughter.
Good morning, Barry. How are you? Hi, Nikki. How are you?
How are you?
Very good. Hello, honey. Oh, wow. Look at you two matching today. You look absolutely beautiful. All right. Yeah, well, yeah, you as well. You as well. All right, then. Come on in. Let's have a little chat. Come on, gorgeous.
Come on, baby.
That's you, Barry. So if we just pop you in a slightly unladylike position, I'm sorry.
Oh, baby,
Hey.
it's okay. It's okay.
All right, so flip it like that. There we go. All right, so we're not talking about this, are we? Which is
That's been with us.
this hernia. Yes. Okay, so that's just a outie belly button. Yeah. Umbilical hernia.
It's here. I noticed it because she does actually enjoy lying on her back. I just noticed it popping out when she's lying in certain positions.
So that does feel like potentially a liver mass.
Yeah, that's okay.
What we'll do is we'll let her lay back, and I just want to have a feel with her now standing up. There we go. Good girl.
Very good.
Okay. And has she been sort of well in herself and eating well and?
Yeah, she's been eating well and she's been well in herself, but she does seem to have lost a bit of weight.
I can feel that her liver is very big. The lump that you can feel through the skin is in fact one of the liver lobes.
What could have caused that?
Well, you're not going to like the answer to that. This one feels like it's on the liver.
Sorry, okay.
Yeah.
At the Richmond practice, Scott's concerned about the mass that has been found on 10-year-old Honey.
What could have caused that?
Well, You're not going to like the answer to that. She is showing classic signs of some type of cancer.
It's devastating news for Honey's owners, with their little Shih Tzu already battling a serious heart murmur and inflammation of the brain.
It's hard to hear, isn't it?
Yeah, yeah.
When you hear the word cancer, you immediately panic bells start ringing, don't they? So, you know, it's probably as serious as we thought it could have been. So we just got to keep our fingers crossed that Scott can work a bit of magic on it.
Scott now needs to take Honey downstairs to take samples from the mass on her liver, so they can be sent to the lab for urgent analysis.
Honey is so brave, and I think she's a lot braver than us, actually.
Come on, gorgeous.
Oh, there you go,
All
baby.
right. All right, do you want to give Mummy and Daddy a kiss?
Bye-bye, gorgeous. Bye-bye, baby.
There's the fan club.
She's been through so much. It's sad to tell all of our friends and family, really, because she's loved not just by me and Barry, but by everyone.
Hello.
Hello.
This precious little lady is Honey.
Hello. Look at your pretty bows. Very cute.
Isn't she an absolute sweetheart? Well, unfortunately, I'm a little concerned about what we're going to be finding today. She has been losing weight, and her mum's found a lump, which she thought was on her tummy, but actually is what I can feel to be a liver mass.
Oh, that's sad news, isn't it?
In the treatment room, Nurse Sam's ready to help Scott take samples from Honey, but there is a complication.
The kicker to that, which will make you, as her nurse, quite nervous, is that we have to do it all conscious.
Great. Why?
Well, she's got a massive heart murmur. She has done for quite some time, and that's a massive compromise to the anaesthetic. So we'll do everything we can to support her right now, make her as comfortable as possible, and hopefully she'll just let us do what is a pretty mean thing, and hopefully she won't hold it against me. So what we're going to do with Honey is give her some pain relief. To start with, we're going to locally anaesthetise the site as well. We're going to do everything we can to make this as pain-free as possible and get the cells we need to make a diagnosis. Nice, deep breaths. Let's all be calm for her.
With Scott not willing to run the risk of a general anaesthetic, this has now become a very delicate procedure.
Okay, everyone ready?
It's a good girl.
Not to worry. So that is not blood that's come out of a blood vessel, but actually blood that's present in this tumour. So fairly nasty type of tumour. When there is a lot of blood cells present in a sample, it can affect the ability to interpret the result. So I'm a little concerned we might not find out what's going on with Honey with these tests.
Good girl, Honey. Good girl.
I would be very surprised, shocked even, if this doesn't come back as cancer. Never have I wanted to be more wrong. Don't want to be right this time around.
Upstairs, an anxious Nikki has been waiting for Honey to recover so she can take her home.
Where's Mummy? Hey? Where is she? Hello.
Honey bunny. Hello, girl.
There she
Hello, my
is.
girl. Hello, my gorgeous one. Oh, what's happened to you? Hey? Oh, Kelly.
Oh. Oh, so she was good.
She was just an angel. Didn't make a sound. Brave as they come. But the sample was quite concerning in that it was a little bit on the bloody side, which you might think, oh yes, he's just hit a vein, but that's unlikely because of how much came out in a short space of time.
Yeah.
But we just need to know what it is first.
Okay.
So
Okay.
how are you guys feeling about everything?
A little bit shock, I think, really. Although we've been contemplating what it could be, it's still not nice. It still feels quite...
Well, you guys are such optimists, I can tell, and so you always think, oh, hopefully it's nothing.
Yeah. I think Barry's more positive thinking than me, but I will definitely try my hardest to stay positive over the next few days until we get the results, and give her lots of love and lots of cuddles until we find out what the treatment plan will be.
Let's make this happen.
At the St Margaret's practice,
okay.
Nurse Emma and
Oh, I think
receptionist
it's snuggled
Elle
in.
are plotting
Come
how
in,
they
Chloe.
can convince their boss Scott to let them keep George.
Unfortunately, there is a tall blonde Australian vet that kind of hangs around with us, so I do have to ask his opinion on certain things.
The ginger cat was dropped off to them severely underweight.
Hello.
Hi, Scotty.
Hello, ladies and cat.
Cat's the main reason we're calling.
Okay.
The best way to get around Scott Miller is to flatter him first. So, you know how we really love you?
Oh, of course, it goes without saying.
And you're so handsome and a really good vet.
Wow, this feels really loaded. This is the kind of way that my kids get stuff out of me.
Yes, I'm using the exact same tactic. George needs a forever home. So we have been discussing for a while how we would really like a practice pet. And we feel that George fits the bill. And since it's my birthday, I have extra power here.
Yeah, okay. Am I getting out of the present if I give you George?
Okay, I can make peace with the big ginger cat as my birthday present.
Yay.
Okay, well, why not? I think we're going to have to ring the vet clinic, the Ark.
Oh, George, do you hear that? Elle and I are absolutely over the moon. Scott said that we can keep George as our practice pet. We need to feed him up and get him back to full health, but hopefully he will just become part of the family and settle in really well.
Good luck with all those strong females around me.
He's definitely got a lot of cuddles to catch up with, and I'm very happy to give them, as are all the other nurses.
Bye, mate. Good luck.
Bye. See you later. In the bag.
Yay.
In the bag, George.
Yay.
Come on then, mate. Let's go see the girls, eh? Let's go see your adoring crowd. Hey, Hey, Jean, how are you?
Hi, I'm good. How are you?
Good. This
How are you?
is Cecil.
Surgery is now about to go ahead on 3-year-old Cecil at Scott's Isleworth practice. Nurses Gina and Gemma are going to be assisting Scott with the surgery.
Hi, Cecil.
Guess what the problem is?
You can't breathe.
Pretty much. He makes that noise all the time. Don't you, mate? Does it remind you of anyone?
My dad after dinner.
Oh, really? There you go. You sound like Gina's dad. That's no good, is it? We're going to have to sort that out. All right, well, we're going to probably have to do 2 procedures today. The first is just the fact he has no nostrils, so he's going to have a nose job. Okay. And the second is once we've knocked him out and I can look down the back of his throat, I think there's almost certainly going to be an elongated soft palate, so we're going to have to trim that. So 2 procedures in one day. He can't exercise for very long because otherwise he collapses. He can vomit when he gets really overexcited. And then when he gets home, he pants for a good 10 or 20 minutes before he calms down. So I think Annie is feeling very worried about her little boy today. And the procedure that we have to perform today isn't a simple one. It's one that comes with risks, as do any anaesthetic. Okay, how's that? It's pretty good. So what I've done here is made a bit of a contraption for Cecil's head, which is going to allow me to better visualise all the structures at the back of his throat. Straight away I can see he has an absolute monster of a soft palate. It's going right down into his windpipe and it's causing all the problems that he's struggling with. And what I need to do is to trim away some of that so that it doesn't go down and back over his windpipe. Gemma, if I get you then to hold that and just pull that out a little bit for me. In order to trim the soft palate successfully, I've asked if Gemma can help me with holding some stay sutures, which I've placed, and that allows me to really see it in all its glory, and it's massive. So it's great for Gemma to have that bird's eye view. It does mean that she is giving me a cuddle while she's doing it, but she does seem to be enjoying the surgery. So what we need to do is to try and take away some of that meatiness there. That's a much shorter soft palate that's now not impinging on the windpipe, and he's going to be able to breathe so much easier. I'm sure that this moment, whilst he's under anaesthetic and has a tube down his throat, is probably the first time in his life he's actually breathed properly. That's it.
Good. So that's part 1 done. Now part 2 is the nose job. The nose job isn't particularly tricky, but it is very bloody. What we've got here is the nostrils are just very narrow. There's just virtually no hole there whatsoever. So what I want to do is to flare them out to allow for a bigger hole and therefore more air to flow through with each breath. So he has nostrils. So what do you think?
There's such a huge difference there, and you can see he's actually going to be able to breathe now.
Yeah, I just hope he likes his new look. Will it be obvious if Cecil's had a nose job to everyone he knows? Maybe. I think more from the fact that he's going to breathe so much better, but unless he's got a mirror at dog level, I think he'll be just fine. There you go. Listen to how much quieter you are already. Yes. Aren't you? Yes, you are. Good boy.
A few hours later, Annie is waiting impatiently to be reunited with Cecil. The French Bulldog has recovered so quickly that Scott is happy for him to go home.
I was worrying all day, so I've just been sitting at home and just waiting for Scott to call me. Oh, his nose!
Those, Annie, are called nostrils.
Yeah. Oh no, it just looks better now.
Yeah. Annie seems very happy to see Cecil and not too horrified about his nose. I think I've done a good plastic surgery job on it. Of course, he is breathing much better, which is the most important thing. Hopefully no more collapsing and much more having fun with your mates in the park, hey?
Oh my God, he does look really different, but it does look good now, because before it's just like 2 little tiny little slits. So now it looks like he can actually breathe through his nose.
All right.
Okay, so.
He's like, let me go home before that guy takes any more of my face off.
Thank you so much.
My pleasure. Here you go. Good lad. Your baby's huge. Bye, buddy. Bye, handsome boy. With your nostrils and everything. And your quiet breathing. Hey, good boy.
Thank you.
All right. Take care, Annie. I'll see you soon.
Bye.
Bye, boy.
Bye.
See ya.
Bye.
Bye, mate. Ah, what a cutie.
Allez, porte! Oh, good girl!
Scott's next patient, 7-year-old Elise and her French-born owner Marie, share the same love for high-energy agility competitions.
When she does well in agility, I feel so proud. I feel like a peacock. I mean, I just bloat of pride.
But for now, the Beagle's on the injured list and restricted to outings in the local park.
Elise! Elise has always had a weird gait. She's always kind of had a hula hoop movement with her hips, especially when she transits from walking into a trot. But lately, she has started hopping, alternatively on both legs and then pushing like a rabbit. It looks uncomfortable, it's new, so I need to know what it is.
And she loves the back scratch and the bottom rub.
Marie adopted Elise when she was just a puppy. At the time, Marie was struggling with serious health problems.
I was going through a very, very difficult patch of my life. I had just gone through a major burnout. Clinically diagnosed, no motivation, no interest in anything anymore.
I mean, I poked her. Yes, good girl.
She brought back me having to care for something else. And I hope I'm giving her as much as she's giving me. Elise!
Now it's Marie's turn to support Elise.
I always get very worried, what if something goes wrong? So if we have to do surgery, we will, and it will really, really be last resort.
Hi, Elise. Hello, beautiful girl. How you doing? So what's she in for today?
After one of her agility sessions, she went a little bit too quickly on the seesaw and did a flying beagle, which means that it went up, bop.
Right.
And
But that's not a technical term, I'm assuming.
No,
that's just her trying to fly.
That's it. With those big ears, you would assume there is some lift.
A bit like a Dumbo sort of thing. You'd hope so, wouldn't you? Yeah.
But no, so she's been hopping one leg, the other leg, and then both legs.
Does it seem to get worse with exercise or after exercise?
after exercise.
So which leg do you think hops more? You can't really tell.
I can't really tell. It's really intermittent.
A bit of tenderness in the knee there.
Shibus.
Yeah, a little bit of soreness there, so that's interesting. Okay. I'm just now checking the cruciate ligament. Ooh.
Sorry.
So, you're okay. Wow, that was a pretty extreme reaction. So just what's causing the pain in Elise's knees? Well, it could be anything from a torn cruciate ligament to a small fracture, which would need surgery, to something that just needs a bit of medication and rest. I know. With Elise being so jumpy and nervous, there's no way I can carry out a full examination of her legs without sedating her. But we'll also need to complete x-rays to confirm the diagnosis. Come on, there we go. Oh, I know. I can feel just how stressed both Marie and Elise are. All right, say goodbye to Mummy.
Bye, Beagley.
Marie clearly loves her agility classes with her beagle, and the thought that surgery might put a stop to their favourite pastime will be really difficult for both of them to cope with. This is one nervous little Nelly, I can tell you that.
Oh, bless her.
Yes, her and Mum have got themselves wound up, haven't they? Haven't you? It's not that bad. It's not that bad. All right.
Oh.
Let's give her the sedation.
Wow, she's a bit jumpy.
Hey, good girl, that's it. Calm down.
While Nathan and Scott try to pacify Elise,
good girl.
Upstairs, Marie can only wait and hope for the best.
It's very distressing. It's worse than if it was happening to me. I get very, 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 very anxious.
Oh, you're bouncy. Oh, you're bouncy. Come on. Relax, relax.
It's okay.
Barry and Nikki are riding their own roller coaster of anxiety. The samples that Scott took of the mass on Honey's liver have come back as inconclusive. They're now hoping to find answers about their 10-year-old Shih Tzu at Scott's referral hospital, the Royal Veterinary College.
So I've spoken to Scott and we have agreed that the best way forward is to get better pictures of this liver.
Specialist Dr. Stein Nielsen will be in charge of the investigation.
She will be treated like a VIP.
Oh, good.
VID, I guess.
That's what she's used to.
That she is.
Okay, baby. And see you later. Honey's just everything to me and Barry. She's a massive part of our life.
Good girl.
Here we go. Here we go.
I just hope that when she comes around from the recovery that we've got some answers and we know what the plan is to go forward.
Good girl, honey.
Let's go to sleep, little one. So the plan for today would be first to put her through the CT scanner.
Good girl.
Looking at the images, it's one of the biggest livers I've seen in a dog of this size. You can see it's not the same color everywhere. You've got some darker bits, lighter bits. It's all very blotchy. That's not what we normally expect with a healthy liver. Whatever is going on there is growing in a big way. We'll try to also have another go at taking a little sample of that liver. We are going to use a bigger needle than Scott used. And that is advantageous because we will get more tissue and we stand a higher chance of actually making a diagnosis. Hopefully giving us that answer whether or not it is cancer.
As Honey's samples are fast-tracked in the lab, Barry is anxiously waiting in the RVC reception for the results.
Hi there, Mr. Wilson. Okay. You are...
baby. Can I take her?
Yeah, of course.
Hello, baby. Hello. Here's a good girl.
Shall we go to a room and have a chat?
Yes, please.
Okay.
Come on, girl. Come on. Here's a good girl.
So we managed to do everything, which I'm really pleased about, because I think we've got now the best possible picture of what's going on there. And I have to say that that is not good news in that we do have cancer.
The results show that Honey has advanced cancer of the liver.
Now, some types of these cancer you can perform surgery on. With her, there's very little normal liver left. So I think she's coping better without doing the surgery than if we were to do the surgery.
It's hard to explain, really. I'm not really emotional. I'm not really an emotional person, but when you hear the words and he's got cancer. I didn't know what I was going to do. It's the worst possible news that we could have had.
This is a slow-growing tumor, but how long is probably the question you're going to ask me. That I can't answer. That is something we'll just have to see. And although it's not what we wanted to hear, we can now make a plan for the future, because she still has a future. And maybe we'll be surprised at how long she still will do well.
It's best if that we know, isn't it?
Absolutely. As long as she's eating and drinking and being happy when you come home, you can say honestly to yourself, she's got a good quality of life. There's no urgent action we need to take. So that puts us in a privileged situation in that we can now make quite a quick decision to make sure that she doesn't suffer. But until that time, we can have a lot of good days with her, giving her the best possible life, because we will have prevented any suffering.
Although it's devastating news and it's awful thing to hear, I'd rather know in advance and we can make it as perfect as possible for her. You know, all we can do is make however long she got left special.
There we go, there we go, there we go. Oh, you're bouncy.
At the Richmond clinic, Scott's attempting to find out why 7-year-old Elise is suffering from lameness in her back legs.
All right. Let those nice, happy drugs take effect, yeah? I'm dealing with a very nervous patient in Elise and her equally nervous mum who's waiting upstairs. There we go.
I'm feeling nervous, really. I mean, it has revved up my anxiety.
I've got a concern that she might have some injury to her cruciate ligament. She cried out in the consult room. She was quite sore, so I just want to see if there's any movement there. After examining her legs, yes, there is a tiny bit of movement there, but I do feel that the cruciate ligaments are intact. So now I need to do the x-rays to just give a clear diagnosis. Okay, I'm happy with that. That's all good. Marie absolutely loves this beagle, and they're both addicted to agility classes and exercising together. So let's hope that we're not going to find anything that's going to spoil their fun. X-ray. Parlez-vous Australie? Oui?
At the Richmond practice, Elise is waking up after her x-rays. Scott's trying to find out why the 7-year-old beagle is suffering from lame back legs.
Mon chéri. That's French, right? Oui bien is... Oh, maybe they're the same.
Muy bien is Spanish.
God. S'il vous plaît? Croissant? No?
When Scott attempted his French, I think he went through about several different languages before he got to the right one.
Oh la la. And all that sort of French stuff. Hey, yeah. Hey, good girl. Well done. Elise is waking up beautifully despite my horrible attempts at speaking French to her, and now it's time to go and get Marie. I know just how on edge she'll be right now.
Oh, dopey Elise. Hello, dopey princess.
You're still a little bit sleepy, aren't you, sweetie?
Oh, I think she is.
Elise loves her agility competitions, and owner Marie is hoping Scott's diagnosis won't spell the end of her beagle's favourite pastime.
Let me quickly show you these x-rays. So, the good news is that there's not major injury to any of the joints. But what there is, however, is quite a significant amount of inflammation in both of her knees. So when she jumped and she squealed when I felt her knees, that was for a very good reason, because actually they're quite inflamed, quite swollen. What we've got here is a classic x-ray showing a dog with joint effusion, which is basically extra fluid in the knee as a result of a potential ligament injury. Instead of a big white fat pad here, there's a black triangle, and that means the knee is full of fluid. This flying beagle has hurt herself in agility, but has not wanted to let her owner, Marie, know. So Elise has soldiered on and continued to exercise, but that inflammation and potential ligament injury is just getting worse. You've been a runner in the past, and so I think you can relate to this. Is actually, as much as you don't want to do it, actually we need to rest her. We need to give her a good 2 weeks off of doing nothing. Really? She is going to sleep on the couch. She's going to be having a wonderful time, but no walks. Because,
really?
Yes.
Wow. Okay.
Because the thing is this is purely inflammation. I'm hopeful that there's no structural damage, but what we need to do is just give it a chance to get better. And the only way we can do that is by resting her.
Wow. I'm feeling so relieved and actually really ecstatic right now because the diagnosis on Elise is actually something quite manageable.
So this is definitely something I can relate to because I've got fat pad injury.
Right.
So, and that was it. Not 2 weeks, I was 6 weeks.
After that resting period, to try and get Lisa's legs moving a little better, I'm suggesting alternative therapies. So things like hydrotherapy, a great way to keep good flexibility, keep the legs moving, but don't have any impact on the joints.
She is not a good swimmer. She's already nearly drowned once in the lake. Someone had to dive in to rescue her.
Wow.
So I hope they're little life jackets where we go to do hydrotherapy.
Thankfully they are, yes, in a lovely fluoro colour, which hopefully she'll find quite fetching.
Pink for Madame Beagle.
Oh, maybe so. It might cost you a little extra, but hey.
Hey, fine.
And no
Anything
expense.
for my Beagle.
Exactly,
Yeah.
exactly.
Anything for my Beagle.
Yeah, you like it up here because you can see everything, can't you?
At St Margaret's practice, the latest addition to the family is still getting used to his new home.
George has come on amazingly. His purring is incredible. It vibrates through the whole building. I think it's lovely.
All that sort of dandruffy stuff is all gone. I mean, look how much better his skin is looking as well. It's not looking as dry.
Oh, and look at his mane. Look, he has actually got his colouring of a lion. Look.
He really does.
Since Emma and Elle convinced Scott to keep George as the clinic cat, he's been getting VIP treatment.
I think George has found his home where it's full of love and lots of care.
Well, hello, I feel like I'm intruding.
You are slightly.
But there's one important person who still has to make George's acquaintance.
Hello, handsome boy. Oh, he's really slumming it here, isn't he? Seems like he's enjoying a bit of grooming. I know why you love him, because you have a bit of a type for a ginger bloke, don't you?
All right. I do love a ginger.
Purring Uncle Scotty, eh?
He's still a bit bony, but is he putting on some weight, Elle, now?
Yeah, he is. He's putting on a little bit of weight. He likes little meals, little and often.
Okay.
So just building him up.
It's very obvious that George has had a tough life. He's very thin. He has a lot of condition that he needs to put on, but he's certainly in the right place for that.
I hear this is your favourite at the minute. Oh, you smell that one.
Well, he gets better service than I do.
Oh, yum.
He seems very happy here. Long may he reign in St Margaret's.
It really feels like he's already part of the family, doesn't he?
It really is.
Yes.
He's like hotel vet on the hill. Who wouldn't want to stay?
Absolutely.
5-star treatment, isn't it?
Nothing but the best.
Are we ready? Are we ready? Come on, that's it. We can do it. Good girl.
As for Elise, after 2 weeks of rest, the injured beagle is now ready to get in the deep end with canine hydrotherapy specialist Nikki.
Good girl.
Good girl.
The playful beagle developed inflamed, swollen joints in her back knees and now needs to build up the strength in her muscles.
Elise is fab. She's a great little patient.
Very good.
We've focused on working her in the pool. Obviously, it's non-weight bearing movement, so it's very safe for joints to work in the pool. We're not going to strain anything.
Oh, wow. Good girl.
This is a bit like Pilates for people. It's exercising the core and asking her to balance.
Let's go. Good girl.
Although Elise is doing well, the beagle will need several more sessions in the pool before she's ready to return to her agility training.
It'll be great when Elise is back to her old self and when she doesn't have her hop anymore. I'll have my beagle back. Ah, that's a good one. That's a very good one.
Wow, what my sheepy.
Mommy's been warming it up for you.
Oh, come on then, there's a good girl.
It's been 3 weeks since Honey was diagnosed with liver cancer. So far, there has been no signs the little Shih Tzu is in any pain.
It's a nice bit, isn't it?
And owners Barry and Nikki are making sure Honey has everything she wants.
One more.
Honey's behaviour has changed, yes. So because she's been getting spoilt every day, she will only eat roast chicken, and it has to be hot.
There's a good girl. Lovely.
I'm really glad that we went ahead with the CT scan and to know the result, really, because it means we can spoil her every day more than what she is already.
After such devastating news, Scott's stopping by to see how they're all coping.
Well, someone's sounding feisty. Hi, Scott. Hey, Barry, how are you? Hi, Nick. Good to see you. Hello, gorgeous.
Just to say hello.
Come on.
Come on, baby. Good girl. Honey is very clearly the boss of this house, and although she's unwell, she doesn't know it. She is really taking advantage. Yeah, and she's living it up. She's got her own cushion, new toys. I mean, this is all sounding pretty good.
It's a dog's life, isn't it?
Yeah.
Thanks for all your help. You've been really supportive.
If anyone can live a long time and eat you out of house of a roast chicken, it's going to be Honey, isn't it? Hey, you good girl. Yes, you are.
Honey doesn't know that she's sick at all. And she's so in tune with my emotions that if I show that I'm upset, she'll come straight over to me and be like, why are you upset? What's wrong? And Barry keeps saying to me, there's always time to be upset afterwards, so try and enjoy every minute.
And after 2 weeks of total rest, followed by lots of rehab,
On va aller travailler. Attends.
Marie and her excited beagle can finally get back to their favourite place.
Resting Elise, no activity at all, was very, very difficult to manage. She's an active dog, so I was really eager to get her back into exercise mode. En avant, saute, du nez. En avant, saute. En avant, saute. Elise, right, saute. Monte. Elise has been great today for first time back. She hasn't forgotten the moves. I may be a bit more rusty, but she knows her job. Saute.
It's so fantastic that Marie and Elise are back doing what they love most. I know it's been difficult for Marie to keep this beagle from running around, but my instructions for complete rest were carried out to the letter, and now we have a perfect result. Everyone's a winner.
Whee! Bravo! Oui, good girl. I think she was very happy to be back. I saw a very enthusiastic dog, so that makes me happy.
He's a happy dog.
Cecil, up.
Elsewhere in southwest London, things are a whole lot quieter for Annie since Cecil's operation.
The nose job's worked really well for him. He's not struggling to breathe anymore. He's not catching his breath after he's playing.
Today, Scott's arranged to take the French Bulldog for a test run to check out his progress.
Wow, he's even trying to keep up with runners now. Hey, you happy boy? Are you? Walking in the park with Annie and Cecil is a delight because now we can do it and actually hear each other speak. Cecil is so much quieter, he is breathing so much easier and just enjoying himself as a normal, healthy dog should.
I'm really pleased with what Scott's done. The results are amazing. And I'm happy and Cecil's happy.
You're absolutely bonkers, aren't you?